Stephen, do you know where Bob is?
Yeah, he's on the line, but he's got the video and the microphone on mute.
Okay.
Do you want me to start dead on 3?
Yes, please.
Okay, it's now 3 o'clock. Start the meeting, and can I please call for nominations for the election as chairman for 2020/21? Are there any nominations?
I'd like to nominate Councillor Apple Mumford. It's Steve here, Steve Sims.
And is there a seconder?
Yeah, Councillor Smith.
Are there any other nominations? Is there anybody against that? Can they please indicate? No? So, all in favour?
Yeah.
Okay. Thank you. Thank you, members. You've been duly elected as chairman, Mrs. Mumford. Thank you.
Thank you, Stephen. Thank you very much, everybody, for putting me in the chair again. I look forward to working with you for the rest of the year. Just before we do the nominations for vice chairman, I would just like to do some details here of how the meeting is going to be run. But first of all, I'd like to welcome all our guests here today, and I shall be doing their names a bit later on. So this meeting is taking place under the coronavirus regulations, which allow virtual meetings to be held. Please can people mute their microphones if they are not speaking. After presentations of agenda items, I shall ask committee members in rotation if they have any questions. When voting, unless a member wishes his or her vote to be recorded or to vote against, I shall take silence as signifying assent. I'd also like to welcome all members and officers, the public and the press, who's sitting next to me here, at 6 foot apart, and also to all our public that are listening either on Facebook or on the island's radio station. Right, I'd now like to take the election of vice chairman, please, and I would like to nominate Councillor Sims. Could I have a seconder, please?
Councillor Legg.
Thank you, Councillor Legg. Is there anybody against or any other nominations? No. Anybody against? No. I take that as Councillor Sims, you are elected as Vice Chairman.
Well, thank you very much for your support. I did have an 11-page speech written out, but I think I'll probably forgo it in the circumstances.
Yes, please. Right. Agenda item number 3, declarations of interest. None? Right.
A speech written out, but I think I'll probably forgo it in the circumstances.
Agenda item number 4, the minutes of the previous meeting. Are there any questions? Could I have a proposer, please?
Councillor Legg, I'll propose those as the correct record of our previous meeting.
Thank you. Could I have a seconder, please?
If I can second that, Steve Watt.
Thank you. Anybody got anything else? Anybody against? No. I'll take that as they've been accepted. Thank you. Agenda item number 5. I have no urgent items. We now come to agenda number 6, which is the consultation regarding coronavirus. I just have a few words to say before we start. We as a council represent the community of the Isles of Scilly and are here today to try and get answers to the public's concerns. While this is not a referendum, we hope to make some recommendations to full council. Thank you to our health partners for their commitment to be here today, albeit virtually. A thank you also to Dr. Chris Pickin, whose consultation with the island's community has been rated so highly. A thank you also to our local health and care services. There has been a huge amount of work going on in the background by all health partners during this emergency, as indeed there has been within our council. The consultation reveals the fears and concerns of islanders who need to understand what is going on and who is in charge. They need to be involved in the move out of lockdown in a safe way when the government deems we are ready. We are all aware of the risk of coronavirus to public health, but we are also aware of the very real risk to the island's tourism economy. People need assurance regarding what, when, where, and how in order to avoid preventable death. With regards to the island's economy, there is a genuine fear of a 3 winters scenario and what that implies for islanders' livelihood. There are many in Scilly today who have never seen before such restrictions to their civil liberties. Those restrictions are a means to the end of getting our lives back safely. Right, I'd now like to ask Bob if he would like to present this paper.
Thank you, Chairman. Hopefully you can hear me.
Yes, I can.
That's lovely. I would just like to reiterate as well your welcome there to everybody who's been able to attend today, in particular with this item. I think we have Nick Bond of the Islands Partnership, Stuart Reid of the Isles of Scilly Steamship Group, and perhaps, I'm not sure, I can't see in the mobile numbers, Malcolm Bell of Visit Cornwall. And our airport team is here as well, which is excellent. In terms of the consultation, this is very much a snapshot of opinion. People's views will change as we progress through this recovery programme. Members were obviously well aware of the views being posted on social media by the community, and by agreement with the Chairman of Council and Chief Executive, this consultation intended to allow a voice to a broader slice of the community to provide their opinions in confidence. The questions were not constrained, so many respondents, I think, were able to express a number of frustrations, but safely so. As I said, the focus really of the consultation is on recovery, as well as understanding of how our handling of the response to the pandemic has been carried out, and people's understanding of that, and where we go on from there. So definitely not any kind of finger-pointing exercise, but collaborative work in line with national framework, national guidance. I'll take the report as read. However, I do regret and apologies to everybody here today and listening in about the lateness of the results. So I'll open back to you, Madam Chairman, and members for questions.
Thank you, Bob. Well, I'd like to sort of kick off with the questions, and then I'll go round the committee to see what questions they have. First of all, this question I think I would like to direct to our Chief Executive, Paul. We can see from this report that the government's recovery plan was published on May the 11th, and that the government makes its instructions to the nation based on its 5 tests. Can I ask the Chief Executive to say a few words of introduction on how the Council will be approaching this, where its responsibilities lie, and for clarity, what is outside its remit?
Thank you, Chairman, for that. as you know, I think I would introduce that item by saying that in terms of the relaxation of the lockdown and some of the rules and government guidance that comes out, I think we could all admit that sometimes we are frustrated with the lack of speed of that guidance in order to allow us to prepare our response. I mean, you'll have noticed even today there were announcements about zoos, pubs and restaurants subject to the rules being complied with, being allowed to open either on Monday or on the 4th of July for the sake of pubs and restaurants. Specifically, the role of the local authority has changed. Has this pandemic has continued, and the Prime Minister announced a few weeks back that the role of local authorities in terms of coordinating efforts, in terms of outbreak plans, which I'm sure the Director of Public Health or a deputy will talk more in detail about later, would become a local authority responsibility. And actually, even today, I was on a national call asking for further detail on what's actually required in those outbreak plans, which need to be in place by the end of June. You'll remember, Chairman, that this kicked off in terms of the local authorities' role under a piece of legislation called the Civil Contingencies Act, which meant that we escalated this issue as a major incident. Major incidents are declared when one Category 1 responder, such as a public sector organisation, is unable to deal with the scale of the issue on its own. That happened some months ago, and the Local Resilience Forum has been coordinating efforts twice weekly, sometimes even daily, all the way through that phase. And can I put on record my thanks to all of the staff and the multi-agency response on the island that has done all the preparation in a timely manner to ensure that should we unfortunately have a case on the islands, all the plans are in place for us to be able to respond to it. But now we move to a new phase, as you say, Chairman, as we begin to talk about coming out of the lockdown, which everybody is concerned about quite rightly. And we need to do that in close consultation with our local community. So the two things that are emerging, Chairman, which unfortunately I don't have great detail on, but I can tell you the direction it's going, is that there will be outbreak boards, health boards, which will be chaired by the Director of Public Health. There will be three of those boards for the South West. There will be one for Devon and Torbay, one for Plymouth, and one for Cornwall and the Isles of Scilly. The Cornwall and Isles of Scilly board will be chaired by the Director of Public Health, Rachel Wrigglesworth, and I'm sure there'll be Isles of Scilly representation on that. And also there'll be a separate cell, particularly around the Isles of Scilly, where we can talk about the particular issues that face the islands that are different from the mainland. And even today, there was a tabletop exercise to go through various scenarios so that we can begin to come up with answers that I know the public are waiting for. The second thing that will be required is there will have to be a local engagement board set up. We understand that will be chaired by the chairman of the council, and its role will be very much about engaging with our local community, dealing with the concerns that are raised, and coming up with local solutions. Because on the call I was on today, the one thing that was made very clear, because you'll have heard about things about lockdown and all the rest of it, is actually still the best thing we can do is work with our community to encourage them to socially distance, wash their hands, use hand sanitizer, and all those basic public health measures have a greater impact than anything else. So lots of details still awaited, I'm afraid, Chairman, and I'm sure you may wish me to come back with that detail as it emerges. But certainly the role now will be for the local authority to coordinate local response under the direction of the Director of Public Health and us to be coordinating local action.
Thank you, Paul. And another, the communication has been highlighted in the consultation. As the recovery plans develop, it seems clear that a lot of people are expecting these different groups to share a consistent voice in terms of the island's recovery, both from public health and economy. The Chairman of Council now provides a weekly message, have you any thoughts on further communication with the public and how this could be achieved?
Thank you, Chairman. I think you're right. I mean, as I mentioned earlier, I think that the team, in terms of its daily situation updates, has gone down very well with members. But you can always get better and do more. And I know some of the frustrations in the consultation responses where some people felt that we weren't communicating enough. So certainly I will be working with our team because as we go to the next phase, it's very clear that we do need a single communications route. Already I know there are various communications coming out from various either operators or businesses giving information, but we need to try and coordinate that as a council to ensure that we all talk with a single voice and give people the best advice that we can, as I said, very closely in liaison with the Director of Public Health and Public Health England.
Right, thank you. One more question, please. Councillor Nellums, are you there?
Yes, Chairman.
I'd just like to ask you a question, please. First of all, well done to the Steamship Company Group for getting a confidence score higher than the council. Thank you, Stuart. However, however, it was a surprise to see the police ranked relatively low, especially when they are such a fundamental part of the emergency response. As Council's representative on the Community Safety Partnership, do you have anything you can share regarding the police response to date?
Yes, thank you, Chairman. I spoke recently to our police team and posed some questions that have a relevance to basically the first two questions of the consultation. So I'm going to actually, I'll read you out the questions that I posed and then some of the answers that I received. And the very first one was, has there been a change under lockdown in the number or extent of patrols, taking into account any need for officer safety measures? Well, the answer was yes, an increased visible proactive policing of all public spaces, beaches, since the commencement of the restrictions, and also further extended to waterborne patrols with the harbour authorities, where there have been interceptions and advising on yachts of non-Harbour City residents. But additionally, they're also meeting all incoming passengers to St Mary's Airport and proactively challenging any individuals not recognised to establish the reason for attendance. And then also the same thing with monitoring all arrivals of private light aircraft. In regard to requests from the public for advice on regarding social distancing, since the lockdown, they've been regularly contacted or engaged in the street or on the phone, and most questions have been around the confusion of the government guidelines, specifically in the early days of what was deemed essential, and more recently with the stay-at-home aspect, when that was removed and replaced with the stay alert. I think that one has probably caused as much confusion as anything. In terms of cautions and fines, because I know people, some of the community have thought, well, has that taken place? Well, yes, it has, but it's been on a very gentle approach rather than sort of rushing straight in and fining everybody. So they had been warned previously before the fines were given, and then really some engagement and education, and then basically when accepting the penalties, people are apologetic, and there haven't been any further breaches since. Another question was a website saying the station is closed. Yes, it is, but it is on direct telephone contact, and so a lot of the community has been calling up on that, and of course on 101. But because of the increased visibility around the island, they found a natural reduction of visitors to the station because they've been actually talking to the team when they've been out on the streets. In terms of the additional police powers extended under the coronavirus legislation, has it been useful? We are unique here, of course. And so, you know, the local police team have been serving us, I think, quite well. I think with the result of the sort of survey, the actual numbers that put that were really quite low. I think it was 19, which is quite a low number to base that on. I think really the high points were going to be the council, the
steamship company, those sort of things. So I don't take too much worry about the number of people that responded. But I think as time has gone on and the restrictions have continued into months as opposed to weeks, people have become a little bit complacent, and I think it's been the perception that we haven't got it, and we're patrolling the borders, so why are we having to isolate? And I think there is a little bit of friction there where we're probably actually, as I say, getting rather complacent. So there has been some engagement with the community on that as well. Otherwise, let's see what else. I think also there is just one point. The tone that they're sensing in the community is that after what is meant to be, if it happens, July the 4th, and the floodgates open, and a potential for COVID to come in, that there will be a lot of concern. And from the police perspective, they're not sure about how the reaction of islanders to holidaymakers will be, and so they're sort of getting ready for that. But otherwise, I think that's pretty well it at the moment. Anything else you'd like to ask?
No, I don't think so. I'm not quite sure who's here. Is Rachel Riddlesworth here?
Yes, I'm on the call, Avril.
Ah, right. Hello, Rachel. You're representing the Director of Public Health?
That's right, yes.
Have you any comments to make on the answers that have just been given?
Well, I think Paul really explained it well earlier in respect to the sort of lack of clarity around powers that will be given or may or may not be given to local areas to make decisions around local restrictions. Clearly, I mean, it's something I was going to mention in my briefing, but clearly there are public health powers, and usually it's done, in a spirit of collaboration with settings to close them if there are outbreaks, and so there are some local powers and local arrangements to do that already. But in terms of a larger sort of area of restriction in terms of travel, then there aren't currently the powers that they don't exist currently, and they're not delegated to do that. They are under the emergency powers of the government. So unless they change at the moment, we have to work in a process of collaboration and consensus, I think, to come to the right decisions.
Right, thank you. Nick Bond, are you there?
I'm here, yes.
Good afternoon, Nick. Have you got anything to say? Nick represents the Island Partnership.
I think with regards to communication, I think noting IEP's score on the survey, which is obviously lower than one would hope it would be. My view is that reflects a broad frustration in the lack of knowledge generally. I mean, we spent an awful lot of time and paid an awful lot of attention to communicating to members of the Islands Partnership what we know, and also I think being very careful not to speculate on what we don't. The problem with that is that there is an awful lot that remains unknown, and I think to a degree some frustration with that. The key issue there, I think, is with legal matters with regards to accommodation cancellations, and I think we were very reluctant to comment on an area that we took some time to receive some legal guidance on, and remained circumspect for a number of weeks on that until that was forthcoming.
Well, thank you. Yeah, I do agree that actually until government give us some more guidelines, it's very difficult to answer some questions. Have I got Malcolm Bell there from Visit Cornwall? No. Right. Well, that's all my questions. And I think the best way... actually, can I check, first of all, who of our guests are actually present? I've obviously, Nick's there. Malcolm Bell isn't. Is Dr. Pickin there? No. Rachel Riddlesworth is there. Let's to have a look now. Anita Cornelius.
Yes, hello, Chair. Good afternoon. I am here. I think Dr. Dickens here as well, actually.
Okay, maybe he just didn't hear me. I'm sorry if you can't hear me very well. My iPad doesn't seem to be working to its capacity. Right. And Sam Southsea?
Sam isn't on the call this afternoon, Chair.
Okay, thank you. Kate Shields?
She'll join later, Chairman,
Okay,
at 4 o'clock.
All right, I'm the same with Bernadette George. Right. Ruth Goldstein. I think she was coming instead of you, Rachel, if you couldn't make it, wasn't she?
That's right. She's the assistant director, so it's me today.
Okay, and I think we have Nicholas Simpson and Aisling Khan.
Yep, we're both on, I think.
Yeah. Hello.
Right, and Scott Fuller.
We've got Claudia.
Oh, Claudia, right. Thank you very much. Right, I'm now going to ask any of the committee if they have some questions. And I'll start with the Vice Chairman, Councillor Sims.
Desperately trying to unmute here. A question for Paul initially. The 4th of July is banded around all the time as when everything's going to start. Now, I have seen nothing anywhere at all to indicate that that is actually the case. It may well be putative somewhere, but it's certainly not official that the accommodation hospitality sector can open on the 4th of July. Is that not the case?
You're right, Steve. I don't know if you've seen the news today, but in terms of today and yesterday, there was guidance issued to bars, clubs, and restaurants, and the wording used in the government guidance is that subject to the test continuing to being met, that they can open on the 4th of July. So it's still heavily caveated with. The 4th of July is at the earliest is the wording that it actually says in the government guidance. As to hotels and accommodation, the Culture Secretary in a speech, I think 2 days ago, said it was their aspiration for them to be opening in early July, with a priority given to self-catering accommodation. But again, heavily caveated with still need some tests and some detail to emerge. So I think you're right. There is no certainty, absolutely no certainty to the 4th of July date, other than, as I said, currently announced about pubs and restaurants today and yesterday. But certainly the Culture Secretary has alluded to that would be the government's aspiration if the tests continue to be met.
Thank you. So my understanding, and I've got this from a fairly good source, is that the government is reluctant to make announcements about easement of guidelines too prematurely, because people just automatically ignore the fact that there's a date set to it and off they go. So, and his actual words were they do it in a heartbeat, which is not useful for us because we have, if it's say 10th of July, we have a month to get an awful lot of systems in place, which we're ill-equipped to do in 6 months, let alone a month. And this came across in the survey quite stridently, I gather, that people just really don't know what the hell they're doing and how to do it. And this is a major, major issue.
Any more questions, Steve?
Not. Well, actually, yes. One thing for Rachel, the 72 hours it's being bandied about all the time for. You have to leave somewhere empty for 72 hours if somebody's been in there, etc. I mean, this is a real issue for people here because if we do open up, even up partially, it throws bookings right out the window. It will be an absolute logistical nightmare for Stewart, the steamship company, because people are not going to be able to come when they wish to come. If we do open up in a limited sense, then obviously bookings have been very oversubscribed, and it's a logistical nightmare which I do not see a way out of. But hopefully I'll be proved wrong.
So So just for clarification, Steve, do you mean that if there had been a case that had been confirmed and they were staying in accommodation, then you'd have to have that clear for 72 hours? Is that what you're...
Well, it's both of them, really, because if people are asymptomatic, you still don't know. And one of the bigger accommodation providers here, I had a discussion with him, he said they have a duty of care, and his assumption will have to be that everybody who stayed in the accommodation could well have the virus and be asymptomatic. It's a big, big issue, and I don't see, if it could be solved, wonderful.
Yeah, I mean, I assume that this is something that will be challenging any accommodation provider when they open up, and that should be something that I would hope more guidance would be provided, because like you say, that doesn't sound like it would be practicable in terms of keeping, sort of essentially three nights of empty accommodation in the interim. So I imagine there'll be guidance like there are for workplaces around cleaning and disinfecting and the best approaches to that to reduce any spread from people who have been in the household.
I mean, this is an instance which is particularly problematic for the islands because they can't drive 3 days later. They're booked, and the accommodation that they won't be able to book again at another point. It's unlikely to be able to do it because of essentially the chaos which will occur.
Chairman, may I? It's Paul.
Yeah, certainly, Paul.
Chris, Steve, I certainly have heard the rumour of 72 hours, and I've done quite a lot of research, both from the hospitality guidance, the government guidance on hotels that are still open, of course, for essential workers, and I can find no record of 72 hours, so I don't actually know where this has come from.
I know, and I think this is a very useful secondary function of the committee today to try and burst some of these myths, because they are causing people a considerable amount of grief.
I think you're right, and as Rachel said, the only guidance I can see is asking for enhanced cleaning, particularly in kitchens and toilets in accommodation, but there's nothing about a gap between occupants.
Okay, thank you. But they do have to bear in mind that people have a duty of care, and they may well want to put that 72 hours in, irrespective.
Has anybody... do you want to comment further, Rachel?
No, I think that Paul. I agree with Paul in that we haven't heard anything that is as specific as that, and clearly a lot of people will not be infectious, and then that would be very overcautious. So I'd be surprised if that was in any further guidance.
Yeah, I do think one of the problems that I'm hearing from a lot of guest house owners and flat owners is if somebody's staying in a flat and they develop the coronavirus and they have to stay 14 days, and after 7 days there's another person coming into that flat. This is where the problem is on Scilly, and also I'm quite sure that the steamship company or the helicopters will not want to carry anybody on their transport who's actually got the virus. So they're stuck here, really, and what becomes of them if they have to get out of that accommodation, and it also infects everybody else. If it's a B&B, then it affects everybody who lives in that house where they're having bread and breakfast. It's a big, big problem here.
Could I add something? It's Nick.
Yes, please do, Nick.
I think with regards to looking after those who are COVID positive, then I think we need to look into a safe isolation option on the islands, and that was discussed at the meeting that Paul mentioned earlier, and it will be looked into and reviewed, and I think there's every chance that we can put that in place. I think that the 72-hour rule, I also agree with Paul. I mean, I've done some research into it and can find no evidence. A similar view was taken, I understand, at an industry workshop that was Cornwall last week, that no evidence was identified. So I think there's some speculation on that. It is clear that we require more definite hygiene guidance, but I think it's reasonable to expect that to be forthcoming.
Yeah. Thank you. Right. Councillor Sims, any more questions?
No, not at this stage.
Right, thank you very much. Right, could I, Councillor Smith, have you a question, please?
Yeah, thank you, Chairman. I just want to pick up first, going back to a point that Paul made regarding the outbreak plan. I mean, this seems obviously a requirement for government and a very important point. How much is the successful implementation of that plan, how much is that dependent on the successful return of tourism, in your opinion?
I'm not really sure that one is reliant upon the other, unless I'm misunderstanding your question. I think the outbreak plans, they need to, as I understand it, and Rachel will pull me up if I'm wrong. First of all, we're still awaiting the detailed guidance of what actually needs to be in an outbreak plan, because it was made very clear today by Public Health England that they are expected to follow a format which can be mirrored nationally, regionally and locally. But it's obviously the local differences in each of these plans that we would be focused on, particularly, as you say, things like travel to and from the islands and things like that. So I think the outbreak plans are about how we respond as a multi-agency sector and community should we have an outbreak. And obviously, I suppose there is a link, because outbreak plans would be one of the routes to give people confidence to either want to come to the islands safely, or for our residents to feel safe in welcoming people to the islands. So I think the outbreak plans are incredibly important, but I don't think they're linked necessarily to one is linked to the other. Obviously, we would have to deal with the tourism sector questions in the outbreak plan, but tell me if I'm wrong on any of that, Rachel.
Yeah, so we do have some outlines of the expectations in the outbreak management plans, but it isn't going to be nationally sort of specified as to what exactly is in there. So whilst we've got some themes that we're expected to cover, it's down to local areas to add sort of particular issues that are pertinent to their community. So of course with ours we'll have a specific section that will detail the Arthur-Scilly plans. But, you know, it is quite open at the moment. Whilst across the southwest we have agreed a sort of template, that's just us working together as a region, so it could vary.
Yeah, I suppose the other way of asking the question really is that if this July the 4th date, which has to be said, it sounds somewhat unlikely from some conversation, you know, if there has to be an outbreak plan in place with him before you can actually open up to tourism. Is that a fair summation?
Yes, the deadline for the production of the plans is the end of June.
Okay.
So given we haven't got an agreed date for the reopening of hotel and accommodation yet, we've got an expected date, haven't we, but not an agreed date.
All right, thank you. Just to pick up on the 14-day isolation question, I mean, this is something that's been going around a fair bit, and I hear what Nick says around need to be looked into, but it seems to me from talking to accommodation providers, this is the major source of concern. So if either a guest comes down with symptoms, or indeed they are told through the NHS tracing team that they must isolate for 14 days, you know, this is quite a major headache to sort out. And if I could just also get confirmation from Stuart from Steamship that you won't be carrying suspected corona patients, I would imagine.
Jonathan, that's correct. We've said from the beginning of lockdown that we will not knowingly carry COVID-19 positive passengers.
Thank you. So we understand that if somebody becomes ill on the island, they have to be dealt with either here or flown off in an emergency helicopter situation. In the more minor cases, we're expecting them to remain on the islands. Well, where are they going to go? You know, we need to understand that before the whole tourism system can reopen safely. I don't know if anybody would like to come in with a comment on that.
Nick, would you like to comment on that?
Yes, I think it's unlikely, I think, that all of our accommodation stock will be used. So I think there is potential for available accommodation to be used for isolation purposes. That hasn't been investigated investigated yet, but I think there's every opportunity to do that. So we will talk to businesses and on that point.
Yeah, thank you. I mean, it certainly sounds a possibility, but obviously the where of the White House and who pays for it needs to be sorted out. And if I can pick up on another side to this question, we've had some discussion around capacity of supply chains. For example, is there going to be enough food in island shops, co-op, off-island shops, available in the supply chain, and indeed the capacity within those shops physically for people to be able to get in and get the food that they need, both for locals and for visitors. Now, this is quite a serious issue in terms of risk management. I don't know if Paul Masters might like to pick up on that in terms of the learnings from emergency planning.
Yeah, I mean, I think these are all valid points, Jonathan. Of course, we're all working through together, both with our partners and with businesses as well. It's made very clear, as I said today, there was some confusion today about what was the role of local government in terms of enforcement. Because currently, whilst, as Rachel said, we can enforce mainly on individual premises, it's not so easy on a locality. But certainly I'm sure there will be a role for us as a council for environmental health to be checking that shops, etc., follow the rules that are laid down by government in terms of social distancing. And that, of course, does mean that there will be queues possibly and things like that. But I'm sure Nick, as well, is working across with business colleagues about what some of those solutions may well be to come up with innovative ideas about alternatives. But you're right. We will have a role as a local government in making sure that shops open safely and operate safely.
I mean, really, yes, appreciate your answer there. I think this picks up on some points that has been made in the survey, and certainly amongst discussion within the committee. The Isle of Scilly, as we all know, works as a whole in terms of its tourism sector. You can't take many cogs out of the wheel and it still function. Okay, one or two restaurants might not open and that would be okay for the wider tourism experience, but really everything needs to work. And what I'm trying to get a sense of is we have a number of risks. So we have risks around transport, we have risks around health, around supplies, around accommodation, and all of those are quite sort of individual. But actually we need to get a sense of the whole risk for all of the islands. Who understands that total risk management? Have all the criteria been met? And from, answers that Paul and Nick gave, with all due respect, are somewhat reactive rather than proactive. Surely, if we are going to reopen and open the floodgates, as it were, these risks need to be understood and met in order that we can open safely. Because we all want tourists to come back when it's safe and for them to have a good experience here, and for it to be sensible in terms of the health of our community.
Anybody want to? Sorry.
Well, I think, Chairman, that was more of a statement than a question. Certainly, that's the second time the phrase "open the floodgates" has been used, which I don't actually think is fair. I think, our transport operators and everybody is trying to manage that risk by being very, very sensible, trying to work within the guidelines that are laid down by government. But, Jonathan, you're right. We are trying to take a holistic view of all, but you'll know as well as I do, because if you didn't, then you would have all the answers yourself, is that there are some things where we're all struggling. I know on a Cornwall-wide call the other day, there's concern about if campsites open, for example, and we have a wet summer, people would normally be going to all sorts of venues which might be shut. So I think that we live in a new normal at the moment, and even today on the national call, people were saying we were working through these things together because it's a situation we've not faced before. But absolutely, that's why we had the tabletop today, is we're trying to raise all the questions and that need answers. We haven't got answers to all of them, but answers are emerging, and we're trying to open things up safely and carefully, all in line with government guidance. And so far, that is what the council has asked us to do, and that's what we're adhering to.
No, thank you, Paul. I mean, I appreciate this is very complex and difficult. However, I'm raising these points because I think the last thing even the most enthusiastic people around tourism want on failures for visitors to have a poor experience. And it just seems to me that there are so many different factors here. It would be very, very challenging to open up without having a fair degree of assurance that the boxes have been ticked and that the risks have been mitigated as much as possible. And I think as a group of islands, we need to collectively own all those risks and to ensure everything is in place. And if they can't be met, well, we have to question the validity of actually being able to open up.
Thank you, Councillor Smith. Any more questions? Councillor Smith?
No, thank you, Chairman.
Okay, thank you. Councillor Marcus?
Thanks, so from what I've heard so far, I mean, one of my concerns kind of echoes Jonathan's concerns as well, is that we've got a lot of individual organisations holding risk registers about the actions they're taking and how they're going to mitigate possible scenarios, but without a overarching view or those risk assessments being tested by external bodies, either through conversation and meetings, then there is a kind of risk that all these risk assessments will work in isolation. So that to me sounds, and correct me if I'm wrong, that sounds like the local engagement board. That could be one of the responsibilities of that, holding local bodies to account by themselves, that's reassuring, and it kind of eases the frustration I think many of the people on this call probably have with the lack of localisation that has occurred so far in response to COVID-19. Could I just ask Stuart, it's obviously, you're responsible for the main way of getting on and off the island. Can you just outline how you foresee your company taking into mitigating the risk of COVID-19 and kind of the procedures you're going to have in place?
No problems at all. In terms of the response to that question, we've carried out, done a huge amount of work regarding risk assessments across all of our operations. The process starts from booking, when passengers who are booking are informed of the measures that we've implemented, but also confirming that they will not be travelling if they're COVID-19 positive or if they're actually displaying symptoms. Further to that, they'll receive a text message 24 hours prior to travel, again confirming those two very key points, and also to read the guidance on our website in relation to the measures that we're putting in place. On Skybus, we've already communicated that flights will only be happening from Land's End Airport throughout July. That allows us to control the flow of passengers moving between Scilly with distancing on our aircraft, and also between individual flights. So no two flights will be arriving at the same time into St Mary's, so there'll be space in between flights. As I already said, distancing will be maintained throughout July, and face coverings will be mandatory as you arrive at Land's End Airport and whilst you're in the terminal building, right the way through to exit the other side at St Mary's Airport. So a huge amount of work's been done. There'll be also sanitisation on our aircraft in between flights, so passengers will walk into a extremely clean aircraft. In terms of Salonian, we have reduced capacity on the Salonian significantly, down to 25%. For the first sailing on the 4th of July, in response to Councillor Smith's statement about opening the floodgates, we've actually further reduced it on the 4th to allow these measures to sort of integrate and for people in the community to feel comfortable with the measures that we're currently putting in place. In terms of the Salonian, same thing. Risk assessments have been done. I think the risk assessment for Salonian goes up to about 30-odd pages with measures into absolute detail about making sure both our passengers and our employees maintain are constantly safe on Salonian right the way through Penzance Quay on Salonian and as they exit onto St Mary's Quay as well. There'll be controlled disembarkation, there'll be controlled embarkation, social distancing in between check-in, and signage everywhere reminding people to hand sanitize and wash hands regularly and maintain social distancing at all times. So a huge amount of work. We've published detailed guidance which will be on our website, but really that is just a small amount of the work that we've carried out today.
That's brilliant. Thank you very much. Yeah, I mean, because obviously we've had questions about, the disembarkation, pick up of luggage on St Mary's Quay and in Penzance as well. So I'm sure that's all covered, or I hope that's covered in the risk assessment. One question, because obviously medical flights will continue whilst there is reduced capacity, can you assure us in any way that you'll work with health providers to ensure that people here can get to the appointments that they need? Stuart?
Yes, absolutely. We've currently, throughout July and August, put a control that you're not allowed to book day trips through our website. Obviously, that prevents visitors coming to the islands on day trips. But we recognise the importance of day trips for the community going over to medical appointments. There's a pop-up box on booking on our website which states that if you're on a medical appointment, please contact Travel Centre where you'll be able to book capacity to undertake that medical appointment.
Brilliant, thank you very much. And just, sorry, question for Nick, if that's all right. Nick, you're a membership-based organisation. Obviously, there's a significant number of people that aren't members of the Island Partnership. Given that you're going to be an important voice on the local engagement board, how are people that aren't part of your organisation, how are they going to get a voice within that local engagement board?
I think one of the things that we touched upon earlier, one of the things that we need to do, I think, is talk with common purpose, common voice. So I think we're working across various different channels with various organisations inside and outside the membership of the Islands Partnership to determine what those messages are, and ultimately, that they are informed, I think, by government guidelines. So a number of forums that we're working through have representatives outside of the immediate membership of the Islands Partnership. Such as the meeting that took place earlier on today, the OPIC meeting. So I think we are and have been through this process very well engaged. Any sort of further advice on that, much welcome.
Okay, thank you. I think that's it from me for the time being. I've got a couple of questions, but I'll stop there. Thank you, Chairman.
Okay, thank you, Councillor Marcus. Councillor Legg, please.
Thank you, Chair. A couple of my points have already been touched on, but I feel my questions are slightly different to those already been asked. Firstly, how can the Council help support local businesses providing essential supplies to residents and visitors if the supply chain is even more significantly disrupted than it is now?
Who would you like to answer that?
I don't know whether Paul or Nicola would like to come in on that.
I mean, I'll start, and then Nicola might have. I mean, so far in terms of the supply chain, we've not had any indication that it's going to be significantly impacted. I think what we were talking about earlier was actually people flow through shops and how distribution on the islands might be affected. But in terms of distribution also and helping people, particularly shielded, etc., you'll know our voluntary sector colleagues have been brilliant in helping us be available to help get things to people who aren't able to get out, and that process will still be in place. So I don't see any particular issues. We've done a lot of planning on that, and the voluntary sector have been great. And, we've also been trying to help very much on the hardship fund. I think the other thing in terms of helping business, and it's a wider point really, because I think what we're all alluding to here, and I think Avril did in her opening statement, the chairman, was that, we're facing possibly 3 winters here, and therefore the economic impacts on the island, whether we open or not in July, are massive. So with the chairman and vice chairman, we have been lobbying and being alongside our Cornwall colleagues and regional colleagues and our local MPs to push for not just the business grants that that we're currently distributing, but also ongoing support both for the transport network all the way through to next year, and the bid went in on that this week for just over £15 million to see us through till next year. And similarly, we're pushing for similar support for the tourist sector all the way through the season, as is not only Cornwall, but also Cumbria, North Yorkshire and other areas. So we're trying on a national scale to push for support as well as deal with local logistics.
Okay, Nicola, do you want to comment on that?
Nothing really to add, just to say we're not envisaging any issues around freight provision. Actually, demand will be less than normal summer season, so in terms of getting supplies to the island, we're not expecting any issues. The main issue, as Paul alluded to, is congestion, and we're looking at traffic management and pedestrian management down Hugh Street at peak times. So that's work that's ongoing, and be prepared for the 4th of July.
Okay, thank you.
Just to come back on that, my main concern, I suppose, is that there is one shop on each of the off-islands supplying groceries, and 2 main shops on St Mary's to provide the bulk of the population. So should their capacity be reduced by an outbreak, I struggle to believe that the voluntary sector would be able to pick up slack there. Perhaps that's something for the outbreak planning to consider, though. So I'm happy to move on.
Thanks, Harry. Just Nicola, to say we have picked up on that as an issue already, so we are putting some plans in place for that for the off-islands.
Thank you. My next question is for Stuart. You mentioned limiting capacity there. Presumably, you are limiting capacity at the time of booking. However, we don't know for certain when the islands will open. So, should that be pushed down the road to where you have more bookings, how would you determine who gets to travel?
Yeah, that's a very challenging position to be in. We've always said, and it's clearly stated that we will be looking to operate the flown-in from 4th of July as long as government guidance allows us to do so. The number of bookings is low throughout July and August, but there are spikes which still remain, which we are going to have to review as we get closer. Luckily, those spikes don't happen until the very end of July as the school holidays start, and that's something which we are currently monitoring in line with the changes in government guidance.
So would you be looking to limit passengers on a first-come, first-served basis rather than anything surrounding where they're booked to stay?
What we've currently done is we've locked off bookings at a lower level at dates either side of that current date to allow us to give us some flexibility in terms of if we have to move passengers. But until really that government guidance comes out and the clarity, it is extremely difficult to make decisions around that at this time.
My next question is perhaps a bit too broad and a bit too open, but I'll ask it and allow you to decide how to answer. I don't know if Nick Bond may want to come in with an answer to this as well. The Isles of Scilly economy is at the best of times a finely balanced, heavily interconnected web of independent businesses. The Isles of Scilly Steamship Company does a commendable job bringing freight and passengers to the island year-round, facing challenging but predictable circumstances. What support on top of what you're already receiving and what further guidance could be provided to the steamship company in order for it to continue to enable such a honed economy during such unpredictable times?
The 6 million funding that's already been received for the period April to June was critical to support the lifeline transport, not just for ourselves but for all of the Isles of Scilly transport network, due to the significant losses that we're all incurring through maintaining the lifeline link. Without that much needed support, we would have been unable to run the lifeline service indefinitely whilst those restrictions were in place. But as Paul has already mentioned, the business plan has now been submitted to the Department of Transport, which covers that period from July through to March next year rather. The Department of Transport have received that and have already been in touch, which is good news. It shows that they're listening and understanding, but it doesn't obviously provide any guarantees. So future funding is going to be critical to continue the support throughout the rest because of the 3 back-to-back winter scenarios. So absolutely funding is critical. In terms of guidance, for us in the transport sector, I don't believe there's going to be any real additional guidance issued over and above what's already been put out by UK government. I think what would help the steamship company, as has already been discussed, is clarity around the accommodation providers, because that will allow us to determine whether we've got the right level of capacity in place in order to fulfil whatever demand there is, providing government guidance allows us to do so.
Thank you. Nick, did you want to sort of comment on that at all?
There's definite potential, I think, during July and August, if the accommodation sector is able to open. But there isn't sufficient capacity with the social distancing and hygiene measures that the steamship company needs to put in place to satisfy the needs of the accommodation sector. We don't yet know, however, what can open when and in what capacity and how it will do so. So it's too early to say what those outcomes will be, and I think if this has been the case throughout this, we need to constantly monitor the situation and respond as rapidly as we can. It's very clear that there'll be substantially less tourism visitor expenditure in the visitor economy across Scilly than there would be in a normal year, and I think we need to have to date been pretty successful, I think, in putting in as many measures as is possible to offer contingency against that winter scenario. But, still much remains unknown.
Chairman, can I just come back in there? It's Stuart again.
Yes, certainly.
Thank you. Just in terms of businesses on the islands, I think one thing which would be helpful if the Island Partnership are picking up the accommodation, is that continued communication with the steamship company regarding freight supplies. My understanding at the minute is there isn't any backlog of any freight requests, but obviously as demand increases, it would be useful to continue to receive communication through to ensure that we're meeting all the requirements from the community.
I just have another extension to that, my previous question that Paul or Nicola may want to come in on. What can be monitored to ensure that the economy maintains balance and some businesses are not left behind? I'm just thinking that with reduced capacity for tourists coming to the islands, some businesses may not get the level of custom they need to be economical, but as they're allowed to be open, how can they get financial support?
Who did you want to answer that, Councillor Lane?
I don't know whether Paul or Nicola have any thoughts on that. I'm sorry I wasn't able to get that question to you beforehand.
That's okay, it's Nicola here. I can pick that up if you want to have all. So I think it's a common issue.
Frozen. I got the back end of you.
Oh. Okay, I'm answering, Paul, it's okay. So I think the issue is a common one, both here and in Cornwall actually, about that viability of businesses at reduced capacity. It's not one just specific to the islands, but it's felt more acutely here. So we're making representations through the business sell and recovery work that's been done across the local enterprise partnership area to government and to the MHCLG to make it clear that that gap funding, if you like, to make businesses viable is something that needs to be thought through both for this summer and into the next financial year. So we're making that case on behalf of businesses, and absolutely case studies are really useful in that. So what we're finding is if we have the evidence, then we're getting a much better response than if we're using hearsay. So I think it's about quantifying the ask and quantifying the issues and having an open book approach. And using that method, we're getting some traction with MHCLG and government.
Brilliant, thank you. That's all my questions for now. Thank you, Chair.
Thank you, Councillor Legg. Councillor Nellam.
Really, my questions have been answered. Thank you, Chair. It was echoing the question that Councillor Sim said about this sort of mythical date of July the 4th that we're all sort of aiming at, but we don't really know whether it's going to happen. And also, Stuart very kindly answered the question about the measures implementing in terms of transport. So I've had most of my questions answered. Thank you.
Thank you, Councillor Nellam. Councillor Watt, I've left you till last because I know your questions were directed at Malcolm Bell. And I don't think we have Malcolm with us, do we? No. Would you still like to answer the questions, Councillor Watt, to somebody else? Or?
Yes, certainly. Thank you, Chairman. Yes, a resounding silence from Malcolm Bell. But Councillor Mike Nellam actually mentioned the magic word confusion earlier regarding government compliance and guidelines. In fact, it's been described, I think Steve Sims liked this description as well, of having ferocious complexity. I thought that was quite a brilliant phrase. But basically, a question for Nick in general about, is there any assessment of the number of people likely to want to come to Scilly this year, given restrictions on travel and so on? And because really, we may be seen as a coronavirus-free, and people may identify us as an ideal destination. But we need to be very clear in managing their expectations, especially for those regulars who might turn up and see a very, very different Scilly. I wonder if Nick has got any comment on that.
Market intelligence has been conducted at a national level and a regional level. One of the definite findings of national research is an intention by domestic tourists to visit what they perceive as more rural destinations. So interest in the southwest, as it would be in any normal year, is very, very high, and then in various other destinations around the country that are perceived as being more rural. So, for instance, North Yorkshire Lake District would also have high levels of interest. So, you know, that's interesting for Scilly, because that, you know, that there is obviously you know, the normal level of interest there. One of the barriers that's come up is in using non-land-based transport. So, for instance, you know, aircraft and boats. So we don't actually know what at this stage what that means for us. I think the best finger on the pulse practically for that is the bookings that Stuart knows are coming through their services.
Yes, I quite understand that. I mean, it's a magic, well, it's impossible to assess completely. But I just wondered furthermore about if there is to come any further clarity regarding, I mean, it's not a normal season, about what people should do. How would you? I mean, obviously you can get that information quickly to your members, but as somebody mentioned, it is really a membership structure. I think as Dan Marcus mentioned. How would you get that further advice and further clarity on any recommendations to the general island?
I think, I mean, in the first instance, work with partners both inside and outside the Islands Partnership on common message. There's a very definite need to communicate responsible behaviour and what visitors may expect. At this stage, we still don't know, as discussed, you know, what may or may not be open at the beginning of July, end of July, beginning of August, etc., etc. So that's an ongoing process. As we do that, that should be shared, as far as I'm concerned, as broadly as possible. And I think, you know, it's relatively easy to do so through channels that exist, you know, from us to council executives, for instance. And, you know, as far as consumer message is concerned, if that is succinct, it can be shared to every organisation that's in a consumer-facing role and has its own communication channels.
Okay, let's hope that works. Thank you, Chairman. That's all for the time being.
Okay, thank you very much. I have just one question. I don't know whether Anita Cornelius could answer, or Rachel. Would it be possible, when we do open up, to have some sort of testing either at the boat or the airport? And how legal, not legal, how is the testing, is it good testing? I mean, is it reliable, the test that we could do? I believe there's one that can take 20 minutes to do. And who would be responsible to fund that? Probably Rachel, I think.
Yes. So just quickly on the types of tests. So the swab testing that's currently used to detect virus, so when someone is infected, that is most accurate when it's within the first 5 days of symptoms, so sort of early as possible. And it's only as accurate, it's only useful really for that particular day. So, of course, if you give someone a test, you know, on disembarkation or whatever, then, you know, it could be that this following day that they become infectious and then the virus could be detected. So they would think they were negative, but actually then could spend 5 days, you know, sort of being infectious and being quite confident that they were negative. So I think there's unintended consequences of providing testing when it's not for people with symptoms. So at the moment, the testing approach, which is through the swab test to detect the virus, so that's different to the antibody test. then that is done. And I think we should be prioritising anyone who's got symptoms, and that would be the best approach.
Yeah. So there is nothing really that somebody could have, say, at the airport. I mean, if you have to be at the airport an hour or an hour and 20 minutes before your flight, if you hadn't had a test before and could prove that you've been tested, there is no test that they could have there that would give you a result within 20 minutes.
Not that's available currently in the UK, no, that doesn't exist.
No. Okay, thank you very much. Right, I think... Has all councillors asked all their questions? If they have, Councillor Sims, I believe you might have a recommendation?
Yes, I just want... Is Dr. Pickens with us?
No, I don't... Well, no, I don't think he is, because I've got a note at the bottom here. Chris Pickens left the meeting. But we
Yes, sorry, Avril. Yes, I'm online. Apologies.
Hi, Chris.
Right.
How... I think you, given the nature of this conversation, I think you should have an input here. Now, at what stage would... How do I put it? At what stage would you basically get overrun?
Good question, well asked. I think we would get overrun when we were in a, let's say that what I think Public Health England will describe as a outbreak, i.e., and I think the definition from the conversation this morning with Rachel Goldstein is potentially different from what it would be in the mainland. Now I think, and Rachel, please interrupt if I'm wrong with this, I think Public Health England's thoughts about this are if we get a case in a vulnerable population, say for instance Park House or elsewhere, we could safely handle a small number of cases on a weekly basis. For instance, at the moment the government locally are deciding that, the government centrally are deciding that, approximately 5,000 cases a day are manageable by them. It very much depends on the level of both swabbing that's available, and there's two elements to this. There's the local health provision, which is us dealing with, I'm going to say, poorly people, and then there is the public health follow-up, contact, track and trace relating to that as well. What could we manage safely? Probably single figures of COVID patients a day. It is a rather complex equation because it will depend on the amount. We see that the vast majority of people will be reasonably well with this. Who, in a very nice way, as local health provision, we don't see us having significant contact with. Probably, anywhere between about 5 and 10% of people who become unwell may well require admission to our local community hospital, and maybe 1% will maybe require airmed evacuation via SWAST to mainland bodies. So it is a compromise. If we can obviously scale our response towards increases in COVID patients, which will temporarily reduce our response to normal clinical chronic health care. But I would imagine that in our case, we could probably safely, in terms of resource, manage 10, 15 people a week. The slightly unknown with that is it depends on how effective our isolation measures, number one, are how quickly we can respond to suspected cases and how well both local people and visitors adopt them. I.e., if we've got very good comms and very good compliance and very quick, contact tracing, we will be able to limit the numbers of we'll be able to limit the spread of that very quickly. If those measures are not so good by either visitors, locals, ourselves, anyone else, that could potentially rapidly develop out of control. I think the best way I can honestly answer your question is to say that, over the last 12 weeks, we have been in the fortunate position where both primary healthcare, CFT, social care, public health, and anyone else I'm forgetting to mention, we have probably been in the lucky position where we have been able to put in just about every reasonable measure we can to increase our response in the island should we get a COVID outbreak, i.e. the hospital's a lot better prepared in terms of equipment and testing. Medically, within primary health care, we're a lot better prepared. And I think the same goes with our social care services locally as well. So I don't have an absolute figure for you. I don't honestly think I can give you one. It really depends on both public reaction and number one, communication, how quickly we communicate things out, and how well both local visitors and ourselves react to it.
Thank you very much for that, Chris. I'm sorry, the dog's just decided to bark. Well, yeah, there were quite a lot of ifs within that, weren't there? And I think if people are listening to this committee meeting for reassurance, I don't necessarily know they're going to get it, but I think they're probably getting the impression that everybody's really busting a gut to make this work, and I hope it does the trick. But thank you very much, Chris.
I can't give you a better answer than that. It's probably the most candid one I can give you.
No, well, that's what we want.
Yeah, and can I just add to that as well, Rachel? I just thought that it's worth distinguishing between people who are cases who might be reasonably well, and we know that many people won't be so severely affected, and then those people who if they're very vulnerable will be severely ill, and this is what we want to we want to protect those vulnerable people, and I think Chris has explained the infection control obviously and the preparation that's gone into people that are in healthcare settings and care settings. So I'm really heartened that preparation time has been used to get into that position that was explained by Chris. But I think in terms of the test and trace, the follow-up of people who are cases by the national test and trace system supported by local public health teams will be our absolute priority. And as Chris said about an outbreak, we will consider any case in a sensitive setting as an outbreak, any single case. Usually it's 2 or more within a certain time period, but in this case, any individual case in a vulnerable setting like a care home or a school will be investigated immediately with all the resources that we can have to do that. So we're seeing that happening nationally. We're keeping track of the activity of that track and trace scheme, but for the Isles of Scilly and for Cornwall, we'll be able to put extra resources into that. So that's what we're planning now. So, we're moving more back into that contain phase. If you remember at the beginning of the pandemic where, sort of every person who came into the country or the symptoms were tracked down and their contacts were identified and spoken to and given that infection control advice. And that's where we're going back to, and that we're taking that seriously to protect the health of the population, to keep them carrying on as some business relatively usual.
Chairman, Councillor Smith, can I come in?
Can I just before you speak, Councillor Smith, Rachel, I believe you have to go at 4:30, is that right?
Yeah, I do apologise. I thought my item would be a bit earlier on, so I didn't realise that would be a problem.
I'm sorry, it's been a bit longer than... If any questions come up after you've gone, can we please email them to you and you email and answer them?
Of course. Absolutely.
Okay. And I believe Kate Shields has joined us. Kate Shields? No. Yes, Councillor Smith.
Yeah, thank you. Really on the back of those questions there to Chris Pickin and Rachel Wigglesworth, just regarding effectively the local and national plans for control of outbreaks, how much concern, if any, do you have that we are prepared here for tourism or not?
I'll take that one first if we can. I think if the original intent of the lockdown was to prevent overwhelming the NHS and maintaining healthcare delivery, I think, if I'm honest, from a from a primary healthcare perspective, and Anita Cornelius may come in from a CFT perspective as well, I think we're probably as best prepared as we can be. That by no means does that mean that if we get an outbreak, would our service provision not be stretched? I believe it would. However, we have got into that position now where we have established backup from the mainland in terms of additional resources, medical resources, nursing, etc., should that occur. So I think, in terms of and I'm speaking personally, could we be better prepared than where we are now? I don't think we could be.
Well, that's reassuring. I mean, I understand that, in the face of closing down, you were concerned around the position of the island. You were quite vocal about that, and I think a lot of people recognise and respect your leadership on this matter, and thank you very much for it. And really just want to check whether, in the face of opening up, whether you have any residual concerns.
I think that we'll always be concerned. I think it's not. I think we would be not being truthful if we don't think risk will increase. I think it has to, by definition. I'm straying a little bit into Rachel's territory now, because it will be public health that will be able to give us, things like the R rates, things like the social compliance. I think as islanders we've learnt what to do, we've learnt how to act during this, and I think there's been, and I genuinely send my thanks to everyone involved with that. There's been overwhelming, I believe, support for public health measures, which I think it probably, if we're talking about risk and hazard, I think it probably reduces our risk to as low as reasonably practicable. What that means in terms of, people from other localities coming into this area, it's probably public health that will be able to give you a better estimation of, say, risk in Devon, Cornwall, and the wider UK picture, I would think.
Okay, thanks. Rachel, do you want to comment on that?
Yeah, I mean, just in terms of reference to, the regional picture, obviously in terms of infections, we've got quite a different picture across the region. So, obviously, ours are seeing no detected cases. Cornwall, low numbers, so we've got sort of 24 over the last, detected over the last 5 days. So currently, calm, but if you look towards North Somerset and parts of Bristol, they're in quite a different position, and there is more community transmission, which is why you might have heard about the R rate in the region being, one of the higher ones, or, equal to about 1, compared to other regions that actually have higher numbers of cases, but their curve is seems to be all the way down. So small numbers would have affected that. That reproductive rate of 1 means that for every 1 case, it's on average likely to infect one other person. So in the absence of any type of measures or hygiene or social distancing, the COVID would expect that to be 3. So 1 is a steady state. It's obviously we want it to be under 1, and that is the most effective intervention is around the behaviours, which are the hygiene measures, the social distancing. And having that in place and for people to comply to that. So the messaging and communication is important. I think it's fatiguing, but it's, in terms of your community response, that's I think the best measure. And I think you have to realise that nothing is risk-free. No activity is risk-free. There might be other more risky activities that apart from potential infection with COVID, that we need to weigh up and balance.
Yeah, thank you very much. If I may do a follow-up question, Chair, to Stuart, that came out of discussion.
Yes, Councillor Smith, we are getting a bit pushed for time, so...
Sorry, I'll try and be quick.
Thank you.
Stuart, just a question really around the 4th of July date. There seems to be some concern about whether this is a yes or no. I mean, A, what is your understanding of that? And then second, 2 follow-up questions are, essentially, how do you choose who travels? Is it existing bookings, or is it new bookings? Is it first come, first served? And do we know whether effectively people actually have a place to stay? And those are questions that are coming up a lot in the community.
Thanks, Councillor Smith. I think the first 2 questions I think we've already touched upon already. The 4th of July day is a day which I think is has been identified as the earliest opportunity for hospitality. But as we've already said, we're keeping that under review. In terms of passenger numbers, I've said that they are, because of the cancellations that we've seen as a business, with people saying that they don't wish to go or transferring their booking to next year, we are able to carry those that are currently booked. There are a few peaks throughout July and August, and we're keeping them under review, and we've locked off capacity either side of those dates to allow them to travel. In terms of who decides who goes first, that's something which we're currently monitoring in line with the guidance that we're receiving, and we're keeping it under review. The final question you mentioned there was...
well, essentially, yeah, do we know that people actually have a place to stay from the booking travel, but there's a lot of uncertainty amongst accommodation providers?
That's something which we record as part of our booking process. We actually ask for that information. So on the majority of cases, they will already have accommodation to stay. It seems that it's accommodation first and then transport in the vast majority of bookings.
Thank you for your clarification. Thank you, Chair.
Is Anita Cornelius, are you wanting to say something?
Thank you, Chair. I know you're trying to bring this to an end, so I'll try and be very succinct. I just wanted to say, as the health cell lead, it's been a real pleasure to work alongside Chris and Ashlyn and all of the colleagues in Park House and St Mary's who are looking at supporting your islands with both hospital, primary, community, social and domiciliary care. And we've produced a model of care which we continue to test, and we did some more scenarios this week, and we're going to continue to do those on each of the occasions that we do meet. But I would just like to suggest that you've got a lot of experience and passionate people, which I'm sure you all know, on the island, and I'm just very happy to be part of this conversation, to keep open communications with you all, and to reassure you that there is a lot of mainland support that we are working on actively to come over should there be a need from a health perspective. Thank you.
Thank you very much. That's very nice to hear. Thank you very much.
Sea turtles are friendly endangered. SCCF here on Sanibel works to protect these creatures
Councillor Sims, I believe you have a recommendation.
Yes, I do. Let me get it up. It's quite long. I'll hand over to Jonathan for the last three, but I'll do the first three anyway. Now, I'm proposing, these are the proposals. Whilst the Council of the Isles of Scilly fully accepts that we will have to abide to the same recovery guidelines as the rest of the UK, we have unique health and logistical vulnerabilities, as highlighted in the survey and from the evidence received today at the Scrutiny Committee. And that, in the light of this, the islands will need particular bespoke recovery systems in place above and beyond the mainland in order to open up confidently and safely. That's one. Two, it be noted that the island economy is 85% dependent on tourism, and that the summer months subsidise the autumn and winter when income is minimal. Three, it be recognised that even with a partial opening of the islands in terms of income, the islands are looking at 3 winters in succession, and in the light of this, the islands will need additional financial help to get through to next April, whatever now happens, which is very much tied in with 2, really. And now I'm going to hand over to Jonathan for the remainder.
Thank you. Number 4, the collective risk register for Scilly needs oversight by Council to ensure that mitigation of risks in the following areas is met. And if there is a lack of assurance in any area, then that be flagged in the government representation by Council. First bullet point, transport to and from the mainland and inter-island, food supplies and the ability of people to access them, accommodation capacity, safety of guests and accommodation owners, and the potential isolation of symptomatic guests, health services ability to cope, outbreak plan in order to protect elderly and vulnerable residents. Recommendation 5 is the Chief Executive and Chairman, in conjunction with our MPs, be requested to make representation to relevant government departments by June the 25th on these particular concerns that underpin the safe and successful return of tourism. Number 6, the last recommendation, is that the Council and its partners risk assess and keep under review the following concerns. 1, the ability of supply chains to keep the island's residents and tourist populations fed and watered. Number 2, the capacity of the health services to cope. Number 3, the practicalities of the transport network being able to safely bring enough tourists to the island to meet the needs of accommodation businesses to be economical. That's the end of the recommendation.
Have we a proposer for that?
I think they were both proposed by me and Jonathan at that point.
Okay.
Chairman, Justice Bob here. Just to point out, there are also 2 recommendations from the covering report to which those recommendations are additional to.
Okay. Well, we take recommendation 1 first, that members accept the key themes emerging from the consultation and ask such questions as required to satisfy their understanding. That members consider how this information will support the Council's decisions regarding recovery, including with government, in the best interests of the islands, and make recommendations to full Council.
Can I just say something, Chairman? Stephen Taylor here, Deputy Monitoring Officer. I'm not sure those recommendations actually need to be transferred through because they were just requests for what should be discussed at the meeting. The actual meat of what the conclusion of the meeting is as recommended by Councillors Sims and Smith.
Okay, so can we take the recommendations recommended by Councillor Smith and Councillor Sims?
Yeah, and just add one which covers recommendation 1s that members accept the key themes emerging from the consultation and thank the public for responding.
And add that one as well.
Yes, please.
Okay.
I'm happy to propose that one.
Okay.
Yep, I will second that, Councillor Smith.
All those in favour? Is there anybody against this?
I don't think we've got a seconder yet.
Yeah, we second that first one. That's
okay.
the first one. Now we're going to do the ones recommended by Councillor Smith and Councillor Sims. I think there's 6 recommendations.
Yes.
We take them all in one block. Could we have a seconder, please?
Councillor Smith.
Okay. But you were a proposer, or are you proposing?
Councillor Sims proposed.
Right, okay. Seconded by. Is there anybody against? As the silence, I take that as assent.
I'm a little bit confused because I thought Jonathan proposed the initial one, so I'm happy to know the final 3. So I'm happy to second Jonathan's final 3 in case it becomes an issue.
Okay, have you got that, Stephen? Are we all right? Are we legal? Stephen?
Sorry, Chairman. Yes, certainly. What I would suggest, though, quite frankly, is that everything's all taken together and it's actually moved by Councillor Sims and seconded by Councillor Smith. Then there's just one set of recommendations, neat and tidy for Council.
Yes, I'm happy with that.
Yeah, okay.
So, recommended by Councillor Sims, seconded by Councillor Smith. And anybody against? All recommendations. I take that as okay.
Thanks, Chairman.
Thank you very much. Right, well that was quite a long session. Have we got... is Kate, Kate, are you still there? Bob, is Kate still there, or do you want to...
No, hi, I am here. Hello.
You are there.
Hello.
Right, we're now going to move to agenda item 8, because I think Kate... just hello, Kate. You are a little bit pushed for time, probably. Okay, so we now go to Agenda 8. So I'd like to ask you to present that.
Thank you.
Paper, please. Thank you.
Thank you. So we provided you with some papers around our journey out of special measures, how we're responding to COVID-19, and what, if anything, the impact is on accessing care at our CHT in Cornwall. So if I just briefly go through the presentation and go to the second slide, we use this in our staff induction to describe where we've come from as an organisation. So we think it's really important that we remember that we were a 29A warning organisation, that we were in quality special measures, that we had a culture of not escalating poor quality of care, and we had a number of members of our staff feel that they weren't able to have a voice. Even when they knew things were wrong, they felt that they would be criticised and picked if they raised issues of care. So we present this because we had a number of cases that were clearly evidence of our lack of safe and effective care. And there was something about us saying that's who we were. We weren't as good as we should have been for the people of Cornwall and the Isles of Scilly, and we needed to be a lot better. We've put a lot of work into driving up standards of care, looking at harm and risk across the organisation, but really importantly not telling people off for maybe not doing quite the right thing, but helping them to develop the tools, the techniques and the skills to be able to monitor their own practice, but to learn from each other. So we wanted to seek out the truth across the organisation and be very clear where we could improve. So the challenges, we came out of quality special measures, I lose track of time, but I think it was around January time, following our CQC report that we got late last year. We've moved from being inadequate as an organisation when we're in quality special measures to teetering on the edge of being good. It's tantalisingly close, but not yet there. And the issue that will move us from being requires improvement to being the organisation that Cornwall and the Isles of Scilly deserves is by having a really clear focus on safety and ensuring that that's our guiding principle for all of the work that we do across our three hospitals. So our challenges that are aligned to our strategic risks are mainly around patient flow. So even pre-COVID, we were having issues getting people to the right part of our hospital services quickly enough. We had recovered our referral to treatment standard and were somewhere around 85%, and our cancer standards were being routine and regularly met. I'll talk about COVID when I go into the COVID slides. Clearly we've been challenged during the COVID time. Our recruitment was improving and we were getting much better feedback from people working in Trelisk and also St Michael's and West Cornwall Hospital about what it feels like to work here and being involved in the decisions that were made. And feedback from the CQC is that they saw real ingrained engagement with tackling some of the issues that our three hospitals have had for quite a long time. Because we've got that feeling that things are improving, our recruitment has got better, and we've been really successful with international recruitment. We've got some amazing staff coming to us from the Philippines that are giving us some breathing space around our staffing levels while we're using apprenticeships, because what we'd like to do is to create a career pathway across Cornwall and the Isles of Scilly, whereby we are developing our own people to run their own healthcare services. And in doing that, we maybe won't need to go out of county for our next chief exec or our next director of nursing. We're looking at our estate, and for many of you who will have visited, particularly Trelisk, and some parts of the hospital don't look as good as they could do. When I arrived 2.5 years ago, I thought the tower block was derelict and we'd just forgotten to knock it down because it looked terrible from the outside. But when you go in, you realise how you can use space if you've got some imagination and an estate department that wants to make sure that you can keep things running well with good quality infrastructure. We are very lucky that we've been given £140 million to redevelop our cancer services. So Lowen Ward will be provided to the front of the hospital with 3 MRI scanners. And we will also be starting work on our Women's and Children's Hospital with £140 million being given to us to be able to do that. We have another £450 million committed to as part of the HIP2 Health Infrastructure Project second phase. And we're working very closely with Cornwall Partnership Trust about how we use that money not just to invest on either the Trelisk site or St Michael's or West Cornwall, but how we improve community infrastructure so that we've got a network of services across Cornwall, not just pulling everybody into a central point. Before COVID, the Wordle that's on the third slide that is adjusted so that when we're talking to the people that we work with about how they feel about working for Royal Cornwall Hospitals, the words that they say and the frequency of them coming out are referenced to the size of the words in the Wordle. So we have a group of people who are really focused on good quality care and making sure we're passionate about the care we provide for our Cornish people. That is a really good starting point for sustained improvement. In terms of COVID-19, we're preparing for the second wave. We do believe that because of the low levels of infection across Cornwall, that we are in many ways bound to have a second wave. We're just not quite sure when it will be. And I know Anita has spoken a little bit about the model of care that will involve staff from the mainland coming onto the islands. But we have developed a model that goes from domiciliary care all the way to intensive care. And I suppose the first peak was us practicing how we would deploy staff across Cornwall and the Isles of Scilly if we needed to move our people to the place where our folk are the most poorly and most in need of care. And that has started to include our nursing and residential care homes. Probably not as quickly as we should have done, but we are starting to rapidly retrofit that. So the fourth slide talks about where we are now, and we have a very buoyant organisation. So pre-COVID, I need to use my words pre and post-COVID because clearly we've got tired staff now. So prior to COVID arriving, we've got a group of highly energised, very committed, very ambitious set of people for their services. We, for the first time, have got a strategic plan across 40 service lines in the hospitals, and they don't just focus on what happens in Trelisk, St Michael's or West Cornwall, looking at how we provide services for people in their own homes, working with our primary care network directors and also the islands through Anita's leadership, about how we make sure we look after people in a way that we have been told for a long time people would like to have care offered. So all about me, you, them, in your own homes, with as much control around how you access care as possible. We feel like we've become a really strong team within our CHT, and in some respects, all of the work that we've done over the last 2.5 years, being that poor quality organisation, that's not our clinicians' fault. Over many years, decisions made in the wrong places that eroded the critical infrastructure of safe services. We know what harm and risk looks like. So we're using all of those skills we've developed over the last 2.5 years to develop our recovery plan so that we move back to the place where we were becoming very proud of the services we could provide for Cornwall and the Isles of Scilly. We want to get back to that place again because we know that's what our people deserve. They deserve the very best. So we have a strategy that underpins all of this, and one of the things I would like to share with you is how we came to the word brilliant, because I think sometimes it's described as that's what Kate would say. It's actually not. It's what groups of our staff, 2,500 of them, we went to talk to them about our values. You can see running across the bottom of the fifth slide. So care and compassion, inspiration and innovation, working together with pride and achievement, and trust and respect because one and all we care. Those words are really important because behind them comes a series of actions, behaviours and culture that really says that working here, we want everybody to be decent human beings. So we went and refreshed our strategy, and instead of saying we want to be outstanding, we asked people to tell us a word they used that they knew what it meant, because in their real lives, they knew what that word said to them, and brilliant was the word that came out from our staff across the 3 sites. And during International Care Week last year, we asked our staff and our patients and their relatives to tell us what brilliant care looks and felt like, so we can hold ourselves to account for what people who work here and who people experiencing care here feel brilliant is. And that stays at the heart of what we do. Brilliant care with brilliant people with brilliant improvement, because we know we will never quite be good enough, because we'll always want to be that little bit better. On the sixth slide, it takes us into our latest position on COVID. So we've seen 599 positive cases for our hospitals, and we've had 71 lab-confirmed COVID hospital deaths, which is heartbreaking, not least of which, for most of those people, they couldn't have their relatives with them at the time of death. So we've worked really hard to try and make sure that families feel connected, that loved ones feel loved, and that we can respect people's lives and promote as peaceful as possible death during what is for everybody a very difficult time. We've had 122 COVID patients discharged, and I think for me it's really important that more people have gone home than people who have died, and that this is a disease that affects a lot of people very little, some people a lot. And for those, our model of care for Cornwall were the ones who ended up in hospital. So had a higher number of people with a positive diagnosis of COVID because they looked after the people who didn't need non-invasive ventilation or intubation and biomechanical ventilation and critical care. So our response to COVID, I have to say I'm really proud of Cornwall and the Isles of Scilly. The engagement between the islands and the mainland through getting the model of care together was exemplary. The sharing that went beyond organisational boundaries, so we became a county and a set of islands that were focused on one thing, which was reducing harm and promoting people getting better from serious illness. Our model of care is based around where people live. It's not so. The intensive care model drove the initial ask of us flexing from 15 critical care beds to 204. Fortunately, we've never had to do that. So once we knew that the model of care needed to flip so that it was mainly based around people's homes, with those people who needed to come into hospital being the smallest part of the overall model of care. Control mechanisms in place that we still have. We're monitoring very closely the numbers of people who are presenting to hospital, our 111 out of hours telephone calls, the numbers of positive tests that we're seeing from asymptomatic staff and from patients coming through for elective care. Because the one thing that we are really clear about, we need to move back into that surge mentality very quickly if we start seeing infection rates rising across Cornwall. We've had one incident of a small outbreak on one of our wards where we had 11 infected staff and 3 infected patients, and it sort of happened overnight. And for us, that's been a salutary lesson in not forgetting that this virus transfers quickly. Social distancing protects you, washing your hands protects you, but we need to be respectful of the fact that this virus can be transmitted very quickly between groups of people. So our 4-phase dynamic response plan for each of our care groups and across Cornwall, including the Isles of Scilly, takes us from a place where we started with full access to all services to no access to any services other from urgent presentations to ED and COVID positive patients. We're now back around a phase 2 of our plans with turning on urgent cancers. So people who are likely to die if they don't have their cancers, or people their cancer operations, or people who will face irreparable damage if we can't operate within a timeline that is acceptable. That is outstripping our demand at the moment, so we're starting to look at using other facilities. So the Duchy Hospital we want to use for NHS work in totality for the rest of this financial year. We will be moving work into West Cornwall Hospital, and at this point we will retain trauma services down at St Michael's Hospital, because one of the impacts of breaking your neck of femur is that outcomes are really poor if you're not operated on very quickly. So we want to keep that work away from the main Trelisk site, if at all possible. We've been very open and clear with our communications. I've been doing twice weekly blogs with our staff, and we've got very easy methods of contacting people if people want to. I've got on my phone a working in confidence app where people can just send a query along, and I'll answer that directly. Or they can email the Chief Exec inbox, me personally if they feel they need to, along with any of our directors. We were trying to make this as easy as possible for people to share their concerns and their celebration during the course of what has been a very difficult time. So There are areas of focus and adaptation that we will be clearly continuing to focus on. So system working has been Cornwall and the Isles of Scilly's saviour. We've moved into a space that I think I would have said we couldn't do 6 months ago, and we've moved there very fast, and we are seemingly staying there. So our focus is on high quality access to care, not the name of the organisation that people work for. We're looking at quality and safety. We have punitive draconian visiting restrictions in place. At this point, we don't think we will lift those. We're having a conversation through our board, but also with the clinical practitioners forum for Cornwall and the Isles of Scilly, because we're starting to see a small increase. I mean, it is a tiny increase. We've gone from 4 positive patients to 8 positive patients in the hospital, and we are seeing a slight increase in staff numbers being diagnosed positively with COVID. So we don't want to increase footfall, particularly on the Trelisk site. We think one of the ways we've been able to manage transmission, internal transmission in the hospital so effectively, is that we've had lots of empty space so we could socially distance patients on our wards. We're focusing on communications. Nature abhors a vacuum. The more we talk, the more we can explain, the more we can share our concerns and worries within organisations and between organisations we're doing. And I think that's probably one of the keys to our successes. We've been really clear about what we were going to do, and we've worked together. We're focusing on corporate and clinical governance, and that goes back to us being in quality special measures. So we'll be reinstigating our quality improvement delivery board, because I want us to use the same tools, techniques and methods that we use for getting out of quality special measures for our recovery into an acceptable operational performance for our RCHT and more widely across the system. We're focusing loads on wellbeing for our staff. We have been the grateful recipients of huge amounts of kindness from people in Cornwall and the Isles of Scilly. Our staff have been really well looked after. We've decided now is the time to stop taking gifts that are sent to us. We are very lucky. We haven't been furloughed. We haven't lost our jobs. What we're doing is difficult, but we have the certainty of the jobs that we have. So we're sharing the gifts that are sent to us with the more vulnerable across Cornwall, so that everybody benefits from the kindness that has been around the county. We're focusing particularly on our black and minority ethnic staff. So a lot of the news that's coming out in the media is that for whatever reason we have colleagues who are more likely to have detrimental outcomes from COVID. So we're doing individually based risk assessments so that we don't put people with higher levels of predisposition to a poor outcome in higher areas where they're likely to come into contact with the virus. And we're working alongside with our unions to make sure that people feel supported. Digitisation and the infrastructure around it has been fantastic. We've gone from never using things like Zoom, Skype, Teams, to it being the way that we do most of our meetings. I have to tell you, I hate it. I tried really hard to get onto the island to come and see you, because that personal face-to-face way of working I miss. So I, like many other people, are going to have to get over it and find ways of working digitally that mean that we are more effective. And for our patients, lots of our patients like virtual or digital outpatients and consultations. And if you're on a 0-hour contract and you're either on an island or at the north of Cornwall, it's much more convenient for you to be able to access your consultant via a telephone or a computer. So we will be building that into our ways of working for the future. Finance is at the bottom of the list deliberately. So we are being supported with finance that relates to COVID, but we also know that at some point this year we will go back into business as usual, and we're being really, really careful that the decisions we make now, we understand the impact of them as we go forward. I'll just whiz through minimising patient harm because I've touched on it a bit. We have seen our rate dive over the last few weeks. We're at 84% against a target of 92%, and we had increased by over 10% from the year before. We're back down to 64%, and we are starting to go through the same process of checking to make sure that nobody's coming to harm whilst they're on a waiting list. We'll focus on life-limiting surgery and urgent irreparable harm, and also loss of sight or anything that could mean that people's lives are affected for the future, not just for a short period of time. Well, we've got new models of care in place that we will evaluate, but they appear to be working. The clinical assessment and treatment units for our frail elderly, the central coordinating centres that Anita is the director for one of them, they're working brilliantly. We need to make sure they become part of our infrastructure going forward. Trauma at St Michael's, massively disruptive for the staff, but evaluating really well from a patient perspective and from a South West Ambulance perspective. New model of care that when it comes back to Trelisk, we will put in place. Camborne and Redbridge take all minor injuries now to try and keep the Trelisk site footfall free, and we are looking at how we bring Bodmin Hospital back online for more day case facilities. So just to sum, the lessons really relate to COVID, but I think some of them we could bring across into our journey from special measures into a trust that is ready to serve the Cornwall and the Isles of Scilly in the way that it should. Being really clear about our clarity and simplicity of purpose. We are here because people in Cornwall need, Cornwall and the Isles of Scilly need an acute hospital. We should be doing the work that an acute hospital does, and we should be supporting our primary care colleagues so that they can look after people as near to their own homes as possible, and with the GP leading the care, supported by a secondary care consultant. That is all part of our recovery. The quality and detail of management information is really important, so it lets us know whether we're doing the things that we think we're doing in a way that we should be doing them. And that spans, that goes outside of our CHT. There's a health and care incident command centre that I chair on behalf of Cornwall and the Isles of Scilly. And the ICC will start to become our operational barometer for making sure that we're looking after people in the way we should, and that we're continuing to keep safe across our county and our island. And I think I'll take questions, because otherwise I could talk forever.
Thank you, Kate. I'd just like to say, I'm sure all the committee would be with me in saying that we really appreciate all the work that doctors and nurses are doing at in all your hospitals. And it's great to see you out of special measures.
Yes, Fab.
And that was a very comprehensive report, delivered very well. Thank you very much. I'll just go round the committee and see if there's any questions for you. Councillor Sims.
No, thank you. Thank you. A very good report. Perhaps a little bit shorter next time, though.
I'll try my best. Sorry.
Councillor Smith.
Thank you, Chair. Yeah, very good presentation there, and very heartening to read a lot of that. Just really one question out of interest. Obviously, you've been through some challenges. I mean, how is staff morale generally?
So before COVID, it was amazing. And I went on holiday at the end of February and came back at the beginning of March, and the hospital was buoyant. People were absolutely coalescing around this thing that we needed to do together. And now people are tired, and for Cornwall and the Isles of Scilly, we're probably not done yet. So we're putting a lot of effort into trying to support people so they can be resilient over a longer period. So we're looking at things like rest days and making sure that we can move people from busy areas to quieter areas. So I think generally morale is better than it was when I arrived, and people aren't as bouncy as they were in January or February, but we're hoping that we'll get that back by working together.
No, understandably, given the circumstances, but I think that's, on the whole, very encouraging, and thank you. I mean, constantly on the island, the health system comes up as people are very, very grateful for the health system we have. We do get exceptional care, I think, actually, here on the island. And, just to pass that on really from the community, we're very appreciative. And, thank you for your engagement with us here in the committee.
Thank you.
Councillor Marcus.
Thank you. Thanks for the report. Just on page 45 of the agenda, you've got the incomplete performance stats. How long do you think is it going to take for the trust to get back to something approaching normality in terms of getting getting patients through the doors, basically.
So one of the problems that we've got is because our number in Cornwall is at or around 1, all of the surgery that we undertake has to be treated as positive surgery, because when the anaesthetist intubates somebody, that's an aerosol generating procedure. So once somebody's been through theatres, we have to clear the whole theatre out, clean it, change the air, and then get ready for another patient to come in. So we've effectively halved our surgical time. So we are committed at this point around the people who are most likely to have a very poor outcome. And I'm raising with our commissioners in Cornwall whether there are some procedures that we just won't be able to do at this point. Now, that's likely to be highly controversial, but I think we need to be honest about where we focus the resource we've got at a time when we are still operating under pandemic circumstances. So we've only just started that conversation, which means I can't quite give you an answer, other than if people are at risk of losing life or limb or irreparable damage, they will be right at the front of the queue for intervention. And that will mean that some people who are waiting for routine scans, or myself, I'm waiting for some routine tests, I won't be getting them. My GP will support me with my pharmacist. In the olden days, 3 months ago, I would have been referred into the hospital for some tests, and those sorts of things we need to support primary care with, so that they've got the resources to be able to take on that additional burden, not burden's a horrible word, that additional responsibility, whilst we've got some of our clinicians who will maybe not be as busy as they were before.
Brilliant, thank you. I mean, yeah, and you touched on it at the start of your report about being honest, and if you're honest, yes, if that honesty can go through that process, then I think that will stand you in not good stead. It's going to be, like you said, it's going to be painful for people, but I think they'd appreciate that honesty. And also, it was really heartening to hear about your individual risk assessments for BME staff. There was part of, when I see these reports, part of me always goes to the complaints section.
Yeah.
And it was a bit worrying to see that there was quite a higher percentage of your BME staff saying that the trust they didn't feel the trust was an equal ops employer. Yeah. How are you going to try and remedy that?
So our feedback from the CQC is our equality and diversity needs a really good looking at. And I think we've done it from the basis of what we thought people needed, rather than asking people from protective characteristics what they'd like. So we've flipped it over. We have a champion for black and minority ethnic staff, Edward, who is working very closely with our Freedom to Speak Up coordinator. And Jo, who's the Freedom to Speak Up champion. She's getting a list together of Freedom to Speak Up guardians, no, wrong way around, she's the guardian, they're the champions, where they're happy to post their pictures on our intranet with a little biog about them, so we can get people identifying with people they want to talk to, rather than who we say is available. We've started Q&As with our black and minority ethnic staff, and we're looking at how we get an approach to equality and diversity that is around asking people what you want. And so support groups are so old-fashioned. It's more about a celebration of the diversity we've got across our trust, and how that changes the way that we provide care so that we meet everybody's needs. So we're in the process of setting that up now, and I've invited people to contact me if they want to be part of, I think I might call it a touchstone group, but I'm not quite sure yet. Just a place where we can talk about how we are more equal and diverse in everything that we do. Our chairwoman, Mary McLean, is looking at how we broaden out our non-executive directors, so that we've got voices from different parts of the community in Cornwall, and in that will influence the way all of everything that we do is shaped, rather than it being a bowl fun, which I think it has been, certainly in the recent past.
That's brilliant. Thank you very much. Yeah, and again, I'd like to extend thanks to all your staff, so everyone for working so hard through this. That's it from me, Chairman.
Thank you.
Thank you. Councillor Legg.
Thank you, Chair. Again, I'll echo those thanks to all the staff. You mentioned about the use of digital technology to help people in remote areas for triage and care. I was actually on a working group 2 years ago trying to get this moving, and it's really great to see that this catalyst has caused it to flourish, and hopefully this is something that we can all really benefit from going ahead. I don't have a question because you already answered it, saying that hopefully it would. A question for the chair, though. Will we be moving on to item 7 next?
We will, Councillor Legg.
Okay, I'll save my questions for that item then. Thank you.
Can I share my ambition with you, Councillor Legg? I'm hoping at some point in the future I can have cardiac surgery on my kitchen table, because if Aris Bardi can operate on soldiers in Afghanistan from London, and New York surgeons can operate on soldiers in Afghanistan, why can't I be operated on in the county I live in? So we are, maybe not on my kitchen table, that might not be clean enough, but we are starting to challenge the digital visioning for the South West. We're a long way from some places. It would be really good if some of the technology could meet our local health needs.
That's brilliant to hear. I know SWASP has a good history of working with the military to use military technology in the public sector.
Thank you, Councillor Legg. Is that all?
Yes, thank you, Chair. That's all my questions.
Thank you. Councillor Nellam.
Thank you, Chair. No, really just to echo all the points earlier, and thanks for such a fantastic presentation, but also very much take on the point that your team are pretty well exhausted, but hopefully their morale is still very high. Thank you for the presentation.
Thank you.
Thank you, Councillor Nellam. Councillor Watt.
Well, thank you, Chairman. Yes, can I just, well, it's all been said already, really, but I look forward to the next report in person, possibly a bit longer.
Thank you. Thank you very much, Dick. Talking about operating on tables, when my father was the doctor here for 16 years, this is from 1953, and he took somebody's appendix out on board ship. Anyway, thank you very much for it. Just one question. Could you tell me what is the harm view process?
So the way we use the harm review process is we link it into the management of referral to treatment. So we know that there are some procedures, urological cancers, bowel cancers, where there is a higher level of likelihood of harm just by the presentation that people have. So we ask our clinicians to review their caseloads, and where they've got people where they think disease is progressing, that harm review comes through the referral to treatment process. So those people are pulled out and brought in as an urgent case. And when we were in quality special measures and people lost their sight while they were waiting, or people died on waiting lists, we're using that information that we've got around ophthalmology, cardiology, urology, gynecology to go back through those patient pathways and start to pull out those people who we know will be having an adverse outcome whilst waiting.
Okay, thank you very much. And I presume you've got enough PPE in case of a second outbreak?
So we've got, I keep saying we've got enough PPE, but we haven't been as busy as other parts of the country. And so we're on this push model where it's just-in-time PPE delivery. So yes, we have now. If we start getting busy, I hope that the supply chain will be able to manage it. But Phil Confuse leading on PPE with our head of procurement, and Phil is absolutely on top of this. So I have every confidence that we will have what we need when we need it.
And you started your cancer treatments again. You know, we have quite a few people who come across from the islands. It's always a bit traumatic for them having to get flights and trying to get back in a day, or they have to stay overnight. That was another question. Is there somewhere where people can stay overnight if they come for an appointment and can't get back the same day because all guest houses and hotels are closed?
So, can somebody email me and I'll make sure there is.
Can I interrupt you, Kate? Sorry, it's Anita.
Anita, yes.
Just to say that we've had that occasion through the health sale recently, Avril, and with our brilliant volunteer Cornwall partners, they've been able to connect people with local accommodation. So we've been able to come up with a really brilliant, more sustainable solution, actually, which will help us in the longer term as well as COVID time.
Okay, that's very reassuring. Thank you very much. Thank you very much, Kate.
Thank you.
That's all. Thank you very much for giving up your time. I know you're a very busy lady.
Thank you. It's very nice to meet you all.
Thank you. We have a recommendation that members note the actions taken by the Trust in relation to the Care Quality Commission findings and the impact on patients of COVID-19 pandemic, and ask such questions as required to improve their understanding.
Chairman, can we take the recommendation which is on page 2 of the report, that the committee welcomes the high-level summaries in relation to...
Just do that one then.
Etc. Yes, please, Chairman. I think that'd be simpler.
Okay, to discuss and note high-level summaries in relation to the Trust Care Quality Commission inspection outcomes and acknowledge the improvement in the Trust CQC inspection ratings approved action plan, the Trust's approach and response to COVID-19, the Trust's current position with referrals to treatment times and recovery plan.
And perhaps in view of the comments that members have made during the debate, perhaps if we put at the beginning of it, to welcome the high-level summaries in relation to the Trust Care Quality Commission inspection outcomes, etc.
Yes, we'll add that.
Okay, thank you.
Do I have to have a proposer and seconder for this? Yes.
Yes.
I'm happy to propose it. Steve here.
Councillor Legg, happy to second that.
Oh, yes.
And thank you again.
All those in favour? We'll take it as silent is yes. Thank you very much.
Thank you. Bye-bye.
Thank you. Bye. We now go to agenda 7. Item 7, when I get there. Bob, I think I'm going to ask you to present this paper, please.
Thank you, Chairman. I'll just say a very few words before handing to our colleagues and partners who've been waiting through this meeting. There is a cover report with a single recommendation, and this reflects an awful lot of work that's been going on through the health cell under the incident structure that the council set up with the help of the military. And I will hand over to Anita Cornelius to take us through the paper. Thank you.
Yes, thank you, Anita. Anita, are you there?
Anita's on the line, but she's muted.
Anita, can you
Apologies, sincere apologies. I just could not get myself off mute for whatever reason. I'm not sure. Apologies.
That's okay. That's okay. It's been a long afternoon.
Yes, sorry. I just need to
through this.
Thank you. So I'm conscious of time, and I feel we've probably spent quite a lot of time talking in respect of health and the cell. But as you can see through the paper, we have been working collectively with all those colleagues of yours that I listed earlier today to produce a model of care for the Alsacilly. And fortunately, we haven't had to test it in practice to date, and obviously we're hopeful that continues to be the case. It's fair to say that we were anxious when we initially heard about the island reopening and about the capacity that the health cell and social care colleagues will be able to offer, but the public health colleagues have reassured us that many people, if symptomatic, won't necessarily need intervention from us. And as I said earlier, we've been able to work with many partners on the mainland who've been able to provide us with support and escalation should that be needed through the phases. But as also answered earlier by Chris, it's very difficult for us to guesstimate what some of that might look like and how people present. So we've just had to come up using all the knowledge, skills and experience on the island, and with some of us who aren't on the island but have been over many times in the past, to come up with a model which suits the population of the Isles of Scilly. So I think that what we've provided you, it lists obviously your current provision, the incident governance structure and our triggers for escalation. We're constantly reviewing our model all the time. We're meeting on a weekly basis on a Tuesday, again through virtual technology, which, like Kate, isn't my preferred way of communicating with people, but sadly since February, March, this has been the model that we've needed to embrace. We have been able to, during this phase of COVID, use a lot more of digital technology, and Jenny Candy, your mental health practitioner, has been able to use a virtual system called Attend Anywhere, which means that both herself and indeed consultant psychiatrists, if needed, have been able to give people direct support. We've been able to use that also with some of our specialist services and have got quite keen ambition to look at what that model looks like for the future when we're not in COVID, as well as this current time. I hope, obviously you've had the paper previously, and I'm sure you don't want me to go through every section. So, like I say, I'll probably pause there and take questions, as I am sure from how the meeting has been this afternoon that that might be the best use of the time that's remaining for the meeting. Thank you.
Yes, thank you, Anita. I'll start off with a question. There's a lot of concern in the community about our elderly. Probably myself and my husband are classed in this bracket. And also Park House. So if we did get cases here, I'm sure that everything will be done for Park House and actually to protect our elderly people on the island. I think most people during all this time have been pretty good. Distancing and not going out, just going out once a day when we were allowed out once a day. But things have got a little bit flat now. So I think if the case was to come, I'm sure everybody would do as they were told. But I hope there are plans to protect our elderly here.
So if the question is, are there plans to protect our elderly on the Isles of Scilly, then anybody who is vulnerable or needed to be shielded or has any clinical need would be treated in exactly the same way as your marvellous primary and community care team have been doing for a number of years on the island. So we haven't got complete control, obviously, from a health cell perspective of how individuals choose to live their lives and the risks that they take. And I think that, again, during the course of your afternoon meeting, there's been a lot of reinforcement about following the good hand washing and sanitisation methods and all the things that we've heard through recent guidance and support. So, yes, I think there is a strong plan. We've spent quite a bit of time with Park House and obviously with primary care, and as both Ashlyn, Chris and Claudia are all on the call, I'm going to pause to see if any of them would like to offer any additional reassurance to you at this point. Avril?
Yes, that would be good. Claudia, are you there? Ashlyn?
Well, I think Claudia's had to leave, and I think Aisling left earlier, so perhaps I could help, Scott Fuller.
Ah, Scott, yes. Good evening. Good evening.
So, yes. Sorry?
Almost good evening.
It is. So, yes, so as a service, we've obviously we follow government guidance and government guidelines. We have substantial stocks of PPE that support us to stop the virus going into Park House and to transmuting it to other people in the community. And we are working with Health Watch with volunteers who we have highlighted additional people. So I think we cover around about 250 peak vulnerable people across the islands who we make regular calls to, and we then have narrowed that down to approximately 30 or 40 people who have higher needs. So all of that is means that we stay in contact with people and we are aware of any risks or any escalations and concerns that they have. So we support them with food, shopping, and even down to things like getting newspapers and stuff like that. So it is quite a comprehensive period of support that we've put in place. We've managed to, as an adult social care, we've managed to continue with our assessment process and review processes. So we're keeping on top of where people are and the support that they need, so if any changing needs. Referrals that are coming in from the hospital, we're managing to keep on top of that, and we've had 3 or 4 significant referrals back into from the mainland who have, have put quite significant strains on resources, but actually we've managed to get past that and we're working through that. So in all, I think as I suppose you could argue we've been fighting a phony war for the last few months. However, everything that's been put in place has meant that we are now ready, if necessary, to escalate that through for the next for the next stage. Does that help at all?
Yeah, that's fine. And all your and the other question was what's the morale like with the staff in Park House?
The morale in Park House is good. I think that we are asking people to work. We've changed rotas to support to reduce infection, chances of infection. We are people are asking to they're walking around in masks and stuff that's very alien to them, but they've got used to that and they're doing that. And I think the morale is good. And I think actually the morale again into the community and domiciliary care stuff is good as well. And the one thing I didn't add is we're also trying to support the private providers as well with PPE and stuff and doing that as well. So yes, the morale is good, and I think it is something we're very aware of. We work very closely with Jenny Candy. If there's any support that can be provided that, and the council also has its own independent side of support as well.
Yeah, thank you very much. Going back to you're working in with Health Watch. I believe, Catherine, you are there from Health Watch. Are you still with us?
Yes, I am.
Yeah, I was just like, just a question to you is how are you getting on with your volunteers? I must say, I think you're doing a grand job. Have you got any comments to make?
No, not really, but thank you for that. Everything's running pretty smoothly at the moment. We're still matching up new people. So new people are coming to us for support, which is really good, and we still have people to support them. And all of our volunteers we're in regular contact with, and they know they can call us if there are any issues, which they have been, and we're passing on any concerns to adult social care as well, as soon as they appear to us.
Thank you very much. Thank you.
Again, if I can come in from a primary healthcare perspective, the beauty of what we have out here is that we are small, so we are very, very quick to adapt. And I think that has happened throughout the board, health and social care. I think the key thing that we've got is really, really good comms between us locally. And again, the slight risk that we may have going forward, but it is something that I think we should continue with, is that we will probably identify trends very, very quickly, and we can be certain in the next 6 months that even the common cold will come silly, and people will cough and people will meet COVID criteria. And that might not actually be a bad thing, because we will actually isolate it very, very quickly. And I think we've got the local infrastructure in there to do that. So, again, backing up what Scott said, backing up what Anita said, I think we are as prepared as we can be on the island. It will not make, things will certainly not be easy. But I think, if I was being honest, compared to the rest of the UK, we probably have a pretty flexible and adaptable response compared to anywhere I've ever worked.
Thank you for that, Chris. Yeah, very reassuring you all are. Right, I'll go round the committee members and see if any of them would like to ask anybody any questions on this paper. Councillor Sims.
No, not specifically related to the paper. It's a very good paper, and thank you for everything you're doing. It was a point that was raised to me yesterday by somebody who provides quite a lot of accommodation. A couple of the units that they provide, it's a biggish building, and there are a couple of elderly permanent residents there, and there's some other things as well. And the person who actually provides the holiday lets has decided that whatever happens, they're not going to open up this year, because they don't want to put the elderly permanent residents in danger, which strikes me as very noble and an eminently sensible thing to do. And that type of advice for people, it would be useful, and I'm sure that you've been pumping out advice all the time, but I just wanted to highlight that one, because I think that could be relevant to a number of places here. And thank you again for everything you've done.
Thank you. Thank you, Councillor Sims. Councillor Smith.
Yeah, thank you, Chair. Really just to echo those comments from Councillor Sims, and many thanks to all the staff involved. And probably just a note to make, I think what particularly Health Watch have been doing there is really useful for the community. But certainly from St Martin's perspective, I think the community, and I'm sure it's true on other off-islands, are kind of pulled together in a very informal way, but actually the very supportive social care role. So, my thanks particularly to my community. I'm sure that's echoed across other off-islands as well. Thank you.
Thank you, Councillor Smith. Councillor Marcus.
Thank you. Yeah, I've got one question on page 6 of the report, page 18 of the pack. It talks about discharging a person. And it talks about discharging people into Park House. Obviously, how would that work in practice? I guess this question to Scott and Anita as well. Just because I would imagine you don't want anyone who is suspected of COVID-19 going back into the care home. What's the practicalities around that?
Should I take that, Anita?
Yes, I'm very happy. Well, either, but I'm very happy for you to.
Okay, so we have a very strict procedure for any person coming into to Park House. They would need to have a test before they can be discharged into Park House, and that test needs to come back as negative beforehand.
Okay, so you can't get discharged until your test is negative.
No, you need to have that test first. So that, whether that comes from St Mary's Hospital or from the mainland, and that has happened about 4 or 5 occasions over the last few months.
Okay. Again, if I can help back Scott up on that one, which God really doesn't need, but from a wider perspective. So we already have a number of controls in place. So we know that Skybus will not, or as Skybus as it is at the moment, will not transport anyone with COVID negative swabs. And, again, very much my appreciation to Skybus and as the steamship company for helping us work out that position. So almost everyone coming from a mainland hospital back to us will have had COVID negative swabs before even returning to the islands, which is a real safety feature in all honesty. Again, from a healthcare perspective, and I would just back this 1,000,000%, we have zero intent, and I mean zero intent. It's probably the worst thing we could do would be to discharge someone into the most vulnerable environment that we've got, without a COVID negative swab. I think we've seen what's happened in UK, Scotland, and elsewhere, and that's going to be something that will just not happen here. I think as long as us guys, as local healthcare practitioners, are here.
That's good to hear. Yeah, I just wanted clarification on that, and I think I know from my briefings with Scott and Aisling about for adult social care the amount of care that staff are taking here to ensure that people are safe within Parkhouse. I think you can back that up, can't you, Scott? So,
yeah, 100%. You know, even to their, you know, within their own private lives as well. So it's not just about when they come into work. They're actually, you know, thinking about how they behave out of work, so they don't affect people in work. And I think that shows testament to the commitment they have to the community and the people at Parkhouse.
Brilliant. Anita, just one more question. On the next page, there was something about a national issue with oxygen supply. Can you expand on that a little bit? Because it doesn't really...
Yes. So when of course, this is an iterative document in that we wrote it back in, I can't remember the date now from memory. It feels back in March, I think, is when we started putting this together, March and April. So obviously things have moved on and changed. We had requested additional oxygen cylinders at the hospital, and there had been also some guidance coming out about the increased fire risk on the island of storing more oxygen than we would normally store. But we have been working that through with a variety of different partners, both on and off the island. And the hospital have now been in receipt of additional oxygen cylinders, and that has been checked out with the fire service. So I think that probably didn't have enough at that point for us to put much more in, to be fair with you, Councillor, but that's what that refers to at that time.
Okay, cool, that's great. Good, yeah, it's just a bit vague there, really, which I totally understand.
We can change, you know, we will, like I say, some of this needs to be updated anyway, because as with most documents, as soon as you write it, they're out of date, aren't they?
Yeah.
But, yeah, that's the answer to that.
Okay. And the other thing I was going to just say, you know, in the staffing list, the only, do you feel reassured by the level of staffing that we've got for all the services, including the ambulance as well, which I know isn't your remit, but are you reassured that we can still operate with a potentially increased level of service that we need to?
So that's a really interesting question, which comes back to a conversation that's been the thread of this meeting, in that I'm as confident as I can be at this point, based on the situation we've been fortunate to be in on the Isles of Scilly, with no confirmed positive cases either in the hospital or Parkhouse or in the community. We've got a robust plan about how we would enact additional resource, and in fact we have put in some additional resource already into the hospital and the community team, just so that we had practitioners who were already being inducted into working alongside, and that we didn't bring people over who didn't know what to do. We're looking at doing some more of that, and we've done some within the MIU, and we're hoping to get a couple more for both the hospital and the community. The teams have already got strong links with Helston, so Helston community team already in pre-COVID provided holiday cover to Anita Bedford and her team, and Jenny and Anita have both been over and worked with Helston on the mainland as well. So we have got staff over at Helston, both in the hospital and the community, who would come over. We obviously have also got some arrangements with Chris and his colleagues in respect of GP support, and the elder care physicians in RCHT have also offered additional support to the health cell and the team at the difficult times of if we did get an outbreak of some of them maybe difficult clinical decisions that have to be perhaps made, and hopefully we won't get to that. In respect to the balance between tourism and an increased footfall on the island and the off-islands. We are hopeful from what Public Health have advised us that, most people, if they are symptomatic, will be able to look after themselves, and we will just need to be remaining flexible, agile, and as dynamic as we can be, according to the need that presents from a health and social care perspective on the island. But we're extremely committed to working in an integrated way to support everybody who are normally residents on the island, and when the island makes the decision to have tourists and day trippers again, then we will need to flex our workforce to help support that. So I hope that answers your question.
Sorry, can I just add a little bit to that, if you don't mind?
Yeah.
Just from, I suppose, from Park House's perspective, we have, over the last couple of years, we've been trying to get a more flexible workforce, and we've actually managed to employ, I think it's 4 bank staff currently. 2 of those have been part of the COVID, so that enables us to react in a very specific way and target people to when it's needed. And I think also, as Anita was just saying, that we're working very closely with our health colleagues, and the support between both services, so Park House and the hospital, etc., has been really good. So, we have those links, and that practice enables us to work together to meet the need.
The other thing that I failed to say, which I know you recognise, it's not in my remit, but it is important to the island, is about SWAST. And I know that I've been working with Jeff, and Jeff has contributed to the health cell. And one of the scenarios we went through today flagged up that concern. So he gave us assurance that, again, the mainland have an undertaking to support the provision on the Isles Scilly should there be staff affected on the island. So that's as much as I can tell you on that, if that's okay.
That's great. Yeah, that's kind of
from my side, can I just add, and it's really one for the public, the offers of support, both in terms of logistical support, delivering medicines, offers of accommodation for healthcare staff, absolutely phenomenal, and way and beyond what could be expected. And I think it is a matter of formal record that we do thank our local people that have offered those to us, because that will, we haven't required to use that yet, but that may be required in future, and I think those offers must just go down as a matter of formal record and genuinely very, very much appreciated.
Absolutely. Thank you, Chris.
That's brilliant. Yeah, I think if we can work to getting the reassurance that the mainland partners are hearing us and hearing the concerns of the community about the fragility of services that we've been talking about all the meeting, then that is a good thing. So, and so long as those methods of communication are open and being used, then I feel reassured about that. Thank you very much, Mr. Chairman. That's me.
Thank you. Councillor Legg.
Thank you, Chair. I think Dan has already asked the first question I had lined up. But secondly, moving on to page 18, or back to page 18, under the heading, what does this really mean? It says 50% of people will return straight home with no input from health and social care. What does this really mean? I showed it to my wife, and neither of us could work out 50% of which people are we talking about in this. Don't know if anyone.
Okay, that's a very good point of feedback, and I'm not going to try and come up with an answer which is a politician's one. So we will do better to answer that than we have already by that briefing. I think it was based on your normal population as we know it, but of course that is why it isn't reflective of what might happen with tourism changing. So it's meant to be 50% of the population of the Isles of Scilly, but I need to check that back with the health cell so that I can give you an accurate answer, if that's all right, Councillor Legg.
Yes, thank you. I was a bit confused because assuming that people are triaging with the GP over the phone before attending hospital, I would assume that people are only attending if they need to, or primary care, sorry. Yes, once visitors are here, that significantly changes the population on the island.
Yeah, no, I appreciate that.
My third question that I had written down was about the use of technology, but we've spoken about that already. On page 23 of the agenda pack, there's the sort of flow chart for people being discharged from care and returning back to the islands. The top right-hand box, which is a patient who has been discharged but tests positive, obviously they will not be able to get transport back to the islands, and it states that someone can be put into a block-booked hotel room until they're non-infectious. Presumably that's likely to be for 2 weeks. Who would pay in that situation?
That's a very good question.
So, in the case of someone being on the mainland who tests positive and is able to be cared for in a hotel, we have we've had 3 hotels over on the mainland. That one has been at Polzeth, one has been at Newquay, and the other is the Penventon at Redruth, who've turned their hotels over to the health and social care system, and they've been registered with the CQC as almost like a residential home under that same guidance. So that means that the provision, if they go to one of those hotels, there's no cost to the individual. It's paid for through the normal health and social care funding. Does that answer your question?
Yes, thank you very much. And only to say thank you for everything, and I'm glad you've had plenty of time to prepare, and hopefully we remain in the same situation that we are currently being in a state of readiness.
Yeah, thank you very much. I hope so as well.
And Councillor Nellam.
Nothing further, thank you, Chair. Most of the questions have been answered. Thank you.
Thank you. Councillor Watt.
Yeah, thank you, Chairman. Actually, most of them have already been covered by Dan in particular, but also by Harry. But I would like to compliment the author of the report, particularly for the use of flow diagrams, which I've always considered as an idiot's guide to what-if situations. And particularly those on page 10 and 11. Very, very comprehensive report and very clearly laid out. So thank you very much.
Thank you. I'll feed that back to our colleague who produced those, so that's really kind of you. Thank you. I can't take the personal credit.
Thank you very much. Recommendations here that members note the actions that will be taken by health and care providers during the COVID-19 pandemic and ask such questions as are required to improve their understanding.
Again, Chairman, should we just simply welcome?
I think so.
Yeah, so if that can be amended. And I did hear during the debate that there was a request for a formal appreciation of the assistance from the public in terms of offering accommodation, etc. Do members want that to be added as well?
I would think so. Yes, please.
Okay.
Yes,
we'll finalise the wording then with Bob and yourself then.
Right. Okay.
Okay.
Right. Thank you very much.
Thank you.
Thank you. Now we go to, I'm a bit lost here, agenda item number 9.
Yes, Chair, Chairman. That's the Director of Public Health report, and as we know, Rachel Wigglesworth had to leave the meeting. I don't think there's a deputy who is able to take that report now.
No.
So I suggest we move to
agenda number 10.
Item number 10, which is the Scrutiny Committee work plan. So if there are people that need to leave.
Sorry, Chairman Stephen Taylor here. Rachel's picture is still up on the screen, albeit with muted and with no video. But do members want to welcome her report and ask her to report further to the next meeting?
Yes, I think that would be a good idea. Are all members in agreement with that?
Yep. Yeah, absolutely. Yeah, I think my only concern is there are quite a lot of questions in there that probably need to be answered, and I think maybe the next meeting is a bit too long a gap. I wonder whether they can come back to us sooner than that, because some of these are quite critical in terms of how we move forward and, in relation to tourism as well.
Yes, Rachel Wigglesworth has stated in the comments bar she'd be very happy to respond to any further public health questions offline. So there is no need to necessarily delay, but undoubtedly that by the time the next meeting comes around on I think the 16th of July, there's probably a slightly different report will be coming from public health.
Well, indeed, and the answers to those questions, surely they need to be put in the public domain, as they can't be right at the moment.
I agree. I imagine that Stephen will correct me if I'm wrong, that they could be included in part 2 of the next meeting report.
Yeah, that's what. Yes, certainly, that's what members wish.
Stephen, could they actually go into part 2 of full council report in order to get them out sooner?
Yes, certainly. As long as the accompanying report or minutes refers to them, there's no problem with that either. So, yes, that can be arranged.
Okay, so if members like to support that recommendation.
Yeah, the agenda dispatch, obviously, for the council is on Monday. So it may be that they can be distributed to members and put in the public domain a different way if that's what's needed. It depends when we get the replies.
Okay.
Steve here, may I ask a question? I was distracted then by dogs. Is that saying that the report that we're basically not really going to get today could come to full council? Because I think it would be still useful and it's still timely.
Yeah,
certainly, if that's what members wish. Yeah.
I think that would be really useful, because I was hoping to get this report today, but obviously time's run away with us for obvious reasons.
Perhaps we can incorporate it. Obviously, subject to discussion with Nicola and with Chief Executive in particular, but we could always include it with the COVID report that's going to council.
Thank you, that'd be great.
Yeah, I agree.
Everybody in agreement there?
Yes.
Okay.
Yep.
Right, so we now go to agenda item number 10, Scrutiny work plan.
Thank you, Chairman. Yes, those regular attendees and any regular listeners will be aware that this is a standing agenda item that we have at the committee. It's obviously been through quite a jiggle around with the coronavirus pandemic and the cancellation of an earlier meeting. So I'll take the report as read and accept any comments from the committee.
Shall we go round? We'll go round. Councillor Sims. Councillor Sims?
Nothing to say really this at the minute. There's something I wanted to say in a minute after that's not related to this.
Okay, righty head.
Yeah, given circumstances, I think we'll take it as it is and review it in the next meeting. Thank you.
Thank you you very much. Councillor Marcus.
I'm fine with it.
Okay. Councillor Legg.
Yeah, that's fine.
Councillor Nellam.
Happy, Chairman.
Councillor Watt.
Yes, Chairman, keep going.
Keep going. That's the last. Okay. Bob, is that...
Do you want to take the recommendations then?
Yeah.
Propose the recommendation.
The recommendation that the work plan...
I second the recommendation.
Right, thank you very much. All those in favour? If there's no answer, that's all in order. Okay. Thank you very much. That's the end of the meeting. I'll now close the meeting.
Oh, Albert, there's something I wanted to say, which I should have said earlier.
I'm sorry.
Yeah, it's a couple of points I should have brought up earlier, which I think this is very important, and I think that the public need to know this. At the last transport meeting, which was chaired by our MP, Derek Thomas, Derek made it very clear that from conversations he has had, and this doesn't necessarily mean it's his opinion, but from conversations he's had up in Whitehall, if we try to go UDI, i.e. put our own rules in play to bring recovery, then we will be on our own. The government will not help us. And it needs to underpin how we move forward, because we simply can't go through to next April on that basis. And for this, for me, is the primary function of this meeting, to start to find a way forward between the three minefields of the economic, the health consideration, and also the guidelines that perhaps don't quite work for us. So that was the first point. And the second one, more positively, I'm really heartened by the huge amount of work that has gone into this and the very strong community spirit that has come shining through, which I hope can be maintained when this whole period is just a miserable, fading memory.
Thank you. We note your comments.
And Chairman, can we make thanks also to staff, particularly to Bob, for pulling all this together? I know he's worked a huge amount of time to do this.
Thank you, Bob. Thank you so much. And thank you to all the committee as well, because I know everybody's been contributing to this. Anyway, I shall now close the meeting. Thank you, everybody.
Thank you. Bob, mind you, I would say that we've all been resting and all that sort of thing.
A pleasure.